Good evening. I am calling the St. Louis County Council meeting to order, Tuesday, July 27, 2021. The hour is 6:30 p.m. Please rise and join me for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic which it stands, nation, under God, indivisible, with liberty and justice for everyone.
All right.
Couldn't get through security with them.
Madam Clerk, please call the roll.
Councilmember Days.
Here.
Councilmember Dunaway.
Present.
Councilmember Fitch.
Here.
Councilmember Webb.
Present.
Councilmember Clancy.
Here.
Councilmember Tracus.
Present.
Councilmember Harder.
Present.
Madam Chair, you have a quorum.
Thank you very much. The voting order for this evening will be Clancy, Fitch, Days, Harder, Tracus, Webb, and Dunaway. Before we get started, I want to acknowledge, I believe we have a couple of elected officials in the audience. Representative Greer, is he here? Thank you so much for joining us. I think we have Alderwoman Amy Pelker from St. Anne. I believe she's here. Thank you. And I thought we also had Alderman John Muhammad. I'm not sure if he has arrived yet, but he is was said he would be in attendance as well. So thank you all very much. And before we get going, I know this is a very exciting time for some of you, but we need to maintain some kind of an order so that we can hear each other. And I really, really would appreciate that. We are going to have our rules call for 1 hour of public comment, but I am going to ask the indulgence of this council if they would expand that to 2 hours so that we can get as many people as possible. We will absolutely stick strictly to the 3-minute time frame so that we'll get as many people that want to speak as we possibly can. So I do appreciate that. And so do I have any dissent from the council members? Seeing none, we will move forward in that vein. All right. Is there a motion to approve the Journal of July 13, 2021?
So moved.
Is there a second?
Second.
All in favor, please say aye.
Aye.
No, motion carries. Journal of July 13, 2021 is approved. The meeting of the 20th of July is also up for approval. Do I have a motion for that?
So move.
Is there a second?
Second.
All in favor, please say aye.
Aye.
Those opposed, no. The motion carries. The July 2021 journal is approved. We have no bid openings this evening, so we will move to communications.
Madam Chair, we have no tax compromises, zoning matters, or road and bridge matters this evening, so we will move to other communications. Under other communications, item number 1, 6th District.
Receive and file.
So ordered.
Item number 2, 7th District.
Receive and file.
So ordered.
Item number 3.
First District, receive, file, and the appropriation transfer be approved as requested. Is there a second?
Second.
All in favor, please say aye.
Aye.
Those opposed, no. Motion carries.
Item number 4.
Receive, file, and the issuance of a request for proposal as approved, as requested. Is there a second?
Second.
All in favor, please say aye.
Aye.
Those
Aye.
opposed, no. Motion carries.
Item number 5.
Receive, file, and the issuance of a request for proposal be approved as requested. Is there a second?
Second.
All in favor, please say aye.
Aye.
Those opposed, no. Motion carries.
Item number 6, 5th District.
Receive, file, and the change of ownership be approved as requested.
Is there a second?
Second. Second.
All in favor, please say aye.
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 Those opposed, no. Motion carries.
Item number 7, 4th District.
Receive, file, and the county council be directed to prepare the appropriate legislation.
So ordered.
Item number 8, 4th District.
Receive and file, and the county council will be directed to prepare the appropriate legislation.
So ordered.
Item number 9, 5th District.
Receive, file, and the county councilor be directed to prepare the appropriate legislation.
So ordered.
Item number 10.
Receive, file, and the county council be directed to prepare the appropriate legislation. Same motion to item number 18, and that will be the order.
One moment, Madam Chair. Thank you. Item number 19.
Receive, file, hold on the order of business, and refer to the council as a whole, and that will be the order.
Item number 20.
Receive and file, and that will be the order.
Moving to add-ons, Madam Chair. Item number 1, 3rd and 7th Districts.
Receive and file, and Madam Chair, this is the communications that I placed on the agenda regarding the public health order. And what I would like to do is I invited Dr. Khan from the acting director of the Department of Public Health to come forward and answer questions from the council. So I will ask Dr. Khan to step forward to do that at this point.
Dr. Khan, are you here? Yes. Thank you.
And then after we're finished speaking with Dr. Khan, Madam Chair, I would like to come back to this after public comments to actually vote. So we will take the public comments before we actually vote on this particular item.
That will be fine. Thank you. Welcome, Dr. Khan.
Madam Chair,
Yes.
I think, point of order, I think we need to suspend the rules to do any of that.
I think you're correct. So would you make a motion to suspend the rules?
I'll make a motion to suspend the rules, speak with Dr. Khan, and then come back to this item.
Is there a second?
Second.
All in favor, please say aye.
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 No. Motion carries. Dr. Khan.
Madam Chair, if I could start.
Yes, did you want to ask questions, or did you want him to make a presentation, or how are we doing this?
I was not looking for a presentation, but just to ask some questions.
That was my understanding as well.
Yeah.
Thank you. You can proceed.
Thank you, Madam Chair. Dr. Khan, we certainly have heard of your background before, but most here have not. Can you tell us why you're called Dr. Khan? Are you a physician in the United States?
I'm not licensed to practice clinical medicine in the United States, sir. I'm a public health physician by training and an infectious disease epidemiologist with 25 years of experience in communicable disease control.
And your current position, how did you get into that position? Who hired you and pointed you to that position?
The current administration, sir.
The administration?
Yes, sir.
Who is that?
The county executive, Dr. Sandpage.
Can the county executive terminate you if he wanted to?
Yes, sir. My position is that of an at-will employee, so yes.
Okay. So regarding your public health order that was distributed yesterday to the media at about 9:30 at the St. Louis City Hall, we talked and you said that it was in effect at 8 a.m.
Yes, sir.
And then at a little after 11, you sent an email to all the council members and said, here's the order, right?
Yes, sir.
So what is your position on whether or not that particular order, that it was given to the council, the governing body, before or in concurrence with its issuance?
Sir, in terms of preparing the order, the 8 a.m. timeframe that you're referring to is used only as a beginning of the business day mark. The order itself was released around 9:15 a.m., just prior to the news conference that you've referenced. To the best of my knowledge, the sequence of approval for such an order follows the chain of the executive branch rather than the county council. So in terms of, seeking approval for how to move forward, any department across the county, as you well know from your years in the county, approaches the office of the county councilor to seek clarification. And the advice given to us was to proceed because the state law that you've brought up repeatedly would not be applicable in this instance. That was the guidance provided, and so we proceeded.
So the legal department told you to ignore the state law and follow what Dr. Page told you to do.
Those were not the words used, sir.
Is it close? Maybe you could just, I won't put words in your mouth then. What were you told?
Thank you. I would appreciate that.
Thank you. What were you told then?
The advice provided was that that particular state law was not applicable or relevant to the public health order being drafted.
Okay, so when did you start working on that public health order to be drafted? When was it start? When did the work start to say we're going to have a mask mandate? When did that start?
Wednesday, Thursday last week, sir.
So it started Wednesday, Thursday. It was enacted yesterday.
Yes, sir.
Okay. So when you had these discussions, was it with the City of St. Louis Health Department or how did that work?
No, sir. What we try to do is coordinate public health efforts across the St. Louis region. So it wasn't just the counterpart that I have at the City of St. Louis, it would be the other health departments across other counties in the St. Louis region as well. In this instance, it was the City of St. Louis that was also thinking along the same lines. And so we connected around Wednesday or Thursday last week.
Was there ever any discussion between you and anybody in the county administration to bring this to the council to talk to us about what you had planned?
Beyond the initial question that we asked when we began drafting the order, no.
What was the initial question that you're talking about?
I just provided you the answer, sir.
So there was no discussion between you or anyone else to bring any of this information to the council before it was released to the press?
Not to the best of my knowledge, sir, no.
Was there any reason why you didn't bring it to the council?
Beyond the interpretation provided to us by the Office of the County Councilor, no.
Okay, I will reserve and let others ask questions and come back, Madam Chair.
Is there anyone else who would like?
Madam Chair.
Councilwoman Clancy. And
Yes,
then Councilman Harder.
Dr. Khan, did you prepare any remarks for the presentation this evening or for your, I know you were invited to come, so I imagine you thought about some things you'd like to say. If that's the case, I would like to give you an opportunity to share with us anything that you think we need to consider as we potentially take a vote on masking tonight.
Thank you, Councilwoman. Madam Chair, with your permission, I do have a statement I'd like to make for the record.
Please proceed.
Thank you, Madam Chair. Madam Chair, members of the council, I'd like to bring to your attention the fact that community transmission of COVID-19 attributable to the Delta variant is now at an all-time high across the St. Louis region.
Ladies and gentlemen, we have to hear.
The fact is that the Delta variant is poised to cause more misery, more disease, an increase in hospitalizations, and inflict further damage on the population in the St. Louis region. We monitor these statistics on a weekly basis, a quarterly basis. The trends that we've noticed over the last 2 months lead us to believe that we are now in a very difficult situation. 2 months ago, we were optimistic about finally having turned a corner when the 7-day average of cases had dropped to about 20. Now it is up to 200. The positivity rate of the tests performed for COVID-19 were around 2% back then. Now they're at 10%. There is only one way this is going, from bad to worse. The fact is that the scenario you saw play out in Southwest Missouri has slowly moved up the I-44 corridor. About 12 days ago, Pulaski County and Phelps County, which are right on the edge of the St. Louis region, experienced a surge in cases. Our hospital systems, fortunately, are much more robust compared to the Southwest. They have more capacity to absorb patients. Nonetheless, I can tell you that from consultations with the Pandemic Task Force, which is composed of chief medical officers from the St. Louis area hospital systems, they are extremely worried about being overtaken once again by the burden of this disease. ICU bed occupancy continues to increase. Pediatric patients continue to increase in number, and the disease seems to be striking a younger age group than we saw at the same time last year. Madam Chair, it is my duty to inform you on the record that if the council decides in its infinite wisdom to negate this public health order, there will be more misery, there will be more infection, there will be more death. Most of that will occur, Madam Chair, in your district and Councilwoman Webb's district. The vaccination rates for those parts of the county continue to lag well behind other regions. So I ask you, I plead with you to set aside your umbrage over process issues and permission sequences and listen to public health, and please stand by this order. Thank you.
Thank you. Councilman Harder.
Yes, Mr. Khan, Dr. Khan, if these orders go into effect, what is the enforcement mechanism for these, for the mask mandate?
Sir, we cannot police everybody in the county. What we do know is that the honor system in asking people to wear masks while indoors, especially if they're unvaccinated, has not worked. We will have to look at enforcement mechanisms on a case-by-case basis. Our approach will not be a policing-heavy approach or an anti-business approach. We want people to be able to function as productive citizens. We want businesses to operate, restaurants to operate, entertainment venues to operate. The only slight inconvenience we have placed on people through this order is to ask people to be masked when they're indoors.
Thank you.
Dr. Khan, if someone isn't masked.
Ladies and gentlemen, I'm going to have to ask you, please be respectful of our speakers. When it's your turn to come, you want people to listen to you. So please be respectful, refrain from outbursts because we can't hear each other. Please? Thank you. Who was next? Councilman Tracus. I'm sorry, Councilman Tracus. I don't believe Councilman Harder was done. Councilman Harder, I apologize.
Thank you, Madam Chair. Dr. Khan, so if someone walks into a Schnucks and is unmasked, whose responsibility is that for that person to be masked? Is it the business owner or the person themselves?
I would suggest both, sir. What we're appealing to people to do is to think about the collective good rather than their own individual circumstances or inconveniences. But in that specific circumstance, it would be up to the business to decide how they want to handle it.
So will that business then have to ask that person to leave, or is it up to them to let them shop?
It would be entirely up to them, sir.
So that would be a policy for each individual business. Is that what you're saying?
Yes, sir. Yes, sir. We have deliberately avoided being prescriptive. We believe that business owners are more than capable of being responsible and to listen to public health advice and practice it in a responsible and prudent manner.
So in the case of a food store, which is licensed under the health department, would that food store jeopardize losing their health license if they were to allow somebody to be unmasked in their store?
No, sir. That has never been our plan, nor is any part of our calculations.
So a restaurant, a grocery store is not in jeopardy of losing their license if they allow someone to be unmasked. Is that what you're saying?
Yes, sir.
Okay, so it's up to the person to decide if they should be masked or not?
I would hope that every individual would listen to public health advice and undertake mask wearing in indoor settings, even if it inconveniences them for the sake of the greater good, like I mentioned. However, individual businesses will be able to determine that policy on their own.
And if someone says that they have a health condition and can't wear a mask, Is that all they have to say in order to wear a mask or not wear a mask?
We are not prescribing that, sir, and neither are we asking people to ask for proof or evidence. That would be up to the business to decide.
But if someone says they can't wear a mask because of health, is that okay with you that they not wear a mask?
Sir, I will not tell you that it is okay for any individual to not be masked indoors. But if they so decide and the business or proprietor or operator decides that's okay, sure, we are not interested in policing people.
And that has been the rule for the last year, correct? That if someone has a health condition and they don't want to wear a mask, that there's no harm, no foul, and nobody asks any questions, correct?
Yes, sir.
Okay. Thank you, Madam Chair.
Thank you. Councilman Tracus?
Thank you, Madam Chair. Dr. Khan, if I understood your statement correctly, you started out by saying that the council, if in its infinite wisdom chooses to repeal or vacate the mandate. So I want to make sure I understand what you're saying. Are you acknowledging, sir, that this body has the power to do exactly that?
No, sir. I will not engage in legal counsel.
So
Let
how do
me
you have
finish.
it both ways? Your statement was the council in its infinite wisdom chooses to rescind the mandate.
May I explain myself, sir?
That's what you said, so
Right.
help me understand your statement.
You're an attorney, I'm not, sir. Let me just explain myself. I'm not interested in indulging in legal calisthenics with you or any other member of the council. As far as the legality or relevance of any legal process, please direct those questions at the office of the county councilor. What I will tell you is that if the council votes to negate this public health order, regardless of whether that's interpreted as legal or illegal, the ripple effect will be that it will create confusion out in the public. People will not listen to prudent public health advice, and there will be an increase in infections, more misery, and more death in St. Louis County. That's all.
So my question was whether or not, in your opinion, does the council, in its infinite wisdom, your words, not mine, have the authority to rescind this order?
I do not have an answer for that, sir.
I'm just curious why you would have said that. But moving on, you also said that, well, let me back up and ask it this way. Who does this mandate apply to, sir?
I'm sorry,
Who does the mandate, your order, apply to?
St. Louis County, sir, and all residents in St. Louis County.
Does it apply to Schnucks?
All businesses and residents in St. Louis County, yes.
Okay, so it is applicable to Schnucks, to a restaurant, and other businesses.
Yes, sir.
Now, having acknowledged that, you also said that in your opinion, it is up to both the individual and I believe the example was a restaurant or a Schnucks to police whether or not the mask mandate is adhered to. Did I hear that correctly?
Yes, sir.
Okay. So in your opinion then, a Schnucks or a restaurant has an obligation under your order to police or enforce the order. Is that a fair characterization?
Yes, sir.
Okay. So help me understand then, would you agree or disagree that in using a Schnucks or a restaurant, you are then taking a private entity, a public accommodation, and requiring that they enforce this order? Is that correct?
Sir, I will decline to answer that question. You're arguing a legal point with me. You're arguing a finer legal point with me. You need to talk to the office of the county councilor.
Isn't it important, Dr. Khan, that your order be legally sufficient?
I'm sure it is, sir, but you will have to talk to the county
How are
councilor.
you sure it is? How do you come to that conclusion? You
Sir, the
told me-
only rationale I can provide you is the public health rationale. As I mentioned before, if you're interested in legal gymnastics, that's the person to talk to.
It's your order, sir. I'm interested in whether or not you expect a Schnucks or a restaurant to enforce your order. Yes or no?
Yes.
Okay. And in doing so, are you not then imposing upon a Schnucks or a restaurant the obligation to enforce your order?
Yes.
That being the case, then, how does this not affect access to that restaurant or to that grocery store?
Sir, like I mentioned, it is up to the business owner to enforce it or choose to enforce it. We will not be there to police or fine them or put any obstacle in their path.
You agree or disagree that the order, by the way you've just described it to be enforced, necessarily involves access to a grocery store or a restaurant?
No comment, sir.
That's all I have. I've had to think about this for a while, Madam Chair. before I come back.
All right. All right. Let's bring it down, please. Let's bring it down. We're not done with the inquiry. Councilman Fitch.
Thank you, Madam Chair. Dr. Khan, you read a nice statement after Councilwoman Clancy asked you to read that. What prevented you from bringing that to us last week and saying, here's what's going on in the world and in St. Louis County, and this is what we recommend, Council, we want to let you know. What prevented you from doing that?
Sir, as I mentioned earlier, we look at a ton of information and data to determine what course of action to take. You will remember that some time ago we issued a health advisory, hoping that that would make a difference in the downward trend we were seeing. Last week, we were in the midst of trying to figure out what the prudent public health action would be going forward. So yes, a week ago, I would not have been able to give you a definitive recommendation or answer. The only thing I would have been able to share with you is bits and pieces of information that we were still in the process of collecting. As it was, that information crystallized into a public health decision around Thursday and Friday.
So Thursday or Friday, you could have, or the county executive just said, Madam Chair, I need to have a special meeting with the council and tell them what's going on, right?
Yes, sir.
24-hour notice, right? Sunshine law. Why didn't that happen?
Sir, having worked for St. Louis County, I'm sure you understand that there is a chain of command to follow. There is a process in place. When the press release was issued on Friday, it was to set the stage for the release of the guidelines. That is what I do. I answer to the executive branch. I do not report to you.
I understand that, and I get that. So the county executive decided not to tell the council, and you don't need to answer that, but I heard what you said. So
that's your interpretation, sir. I can't comment on that.
So the enforcement pieces Councilman Tracus talked about, I want to go back to that for a moment. So we met with the county councilor in closed session the other day, and I'm going to waive my privilege here and tell you what she told us is completely different than what you're telling us as far as enforcement goes. So what I said was, who's in charge? I actually think Councilman Tracus, who's in charge of enforcing this? And she said the county councilor's office. That's what's written in the order, correct? So how would this work? So someone walks into Schnucks, they're unmasked, and somebody says, excuse me, sir, you don't have a mask on. I'm going to report you to the health department. So the health department then somehow or another gets this person's information. They go to the county councilor's office and said, I want to charge this person with a violation of the order. They violated the order. Tell me how that works. Is it a ticket? Do they go to municipal court? What happens? And what she told us was, first of all, it's on the individual. It's not on the business. Different than what you're telling us. So you guys didn't talk. So what she told us, it was on the individual, that we could go after the county, could go after the individual for violating the health order. Not the business, the individual. So the way that would work is she would have to go to a judge and say, Judge, Ernie Tracus violated this order. I want you to tell him he has to wear a mask next time he's at Schnucks. And the judge could say, Ernie, you have to wear a mask next time you're in Schnucks. And if he doesn't, the penalty is he's held in contempt of court. That's the enforcement mechanism. Do you differ with what we were told?
I will defer to the county councilor.
So in other words, I think the answer is there's no real enforcement here. There's no plan to enforce. So the signs that are on businesses now, I went into the Firehouse Subs in Chesterfield at 141 and Olive before I came here. And I was not masked to go in. And the 16-year-old working behind the counter said, "Excuse me, sir, you have to have a mask on." And I said, "Well, I don't have one." And he said, "You have to pull your shirt up over your face." And is this really what we want? Is this what we want the businesses doing? Have we given them any instructions? Have we given them any instructions of what they should and shouldn't do before we release this order?
Sir, I don't want to engage in a debate with you about what constitutes a mask or not. I commend the 16-year-old. May I? Madam Chair, if you do not restore order, I will walk away and we will have to have this conversation.
Excuse me, Dr. Khan, I am running this meeting.
I know you
I
are,
am
Madam Chair, but
just a
I'm
minute,
respecting
just
you.
a minute.
I'm asking you to
Just a
restore order.
minute. I am giving you the respect that you need to answer the questions that this council is asking you.
I'm in the middle of answering the
We need to tone
question.
it down. We need to bring everything, get the temperature down so that we can have a level playing field here. We are all here trying to do the right thing for the people that we serve.
I'm sure you are, Madam.
We do not want to get into personals. We don't want to do that. We want to make sure that everybody has an opportunity to ask their questions, be heard, and get the answers. So let's bring it down a little bit, cool our temperatures. You need some water, we can help you with that. But we need to make sure that we answer the questions that the council has for you, okay? And we will again ask the audience to please be respectful. Thank you.
Just one last question.
Yes, sir.
Dr. Khan, let's assume that for some reason that you all tell the public this mandate stands no matter what the council does. Let's assume that happens. And the COVID cases keep going up. What's your next step? Are we talking about shutdowns again? Are we talking about sports going away? What's your next move if they continue to go up?
It is my duty to tell you, sir, that if the situation continues to worsen, all options will be on the table.
Okay, all right. Please.
Please.
That's all I have, Madam Chair. Thank you.
Okay, thank you. Councilwoman Webb, let me let her give an opportunity. Councilwoman Webb.
Thank you, Madam Chair. Thank you, Dr. Khan, for being here, and thank you, audience, for being here as well. I agree with what Dr. Khan said about the chaos and the confusion and setting the stage, and for some, this is political theater. And it's not. It's about people's lives. And what this is doing here, as we're all listening and participating how we feel is appropriate, what it's doing is causing political theater is causing not just confusion and chaos, but it's making a mockery of our governing body. We need to come to a point where we learn to respect each body and we communicate with each other holistically and entirely. What you're doing and participating here today may be indulging in exciting and fun, but it's not when somebody's life is on the line. So stop. I want us all to put aside political differences and think about common sense in this mandate, because it has no teeth, no way to be enforced, no way to follow through on it. What this mandate does, it just causes more hesitance and more disrespect to our governing body. So it's not, and excuse me, because I really want decorum in here, so let's refrain from even agreeing it that way. What we want to do in here is to do what's right for all people. And what I do not allow and what I don't respect is you all using North County as your political football. It does not.
Okay. Thank you.
Because what it does not do, everybody. Because, see, I don't have you in my corner when I want to get economic equity or when we need to deal with crime because we're so focused on COVID and fearful of COVID. I don't have you standing and marching and calling me all day and emailing me over 1,000 times when I'm saying somebody died, that 16-year-old, a woman was shot in churches. None of you all are standing then. You're not even coming to volunteer and picking up trash in North County. So stop using North County at your convenience, but really talk about real solutions for North County, because I'm not here to do that. What I'm here to do is to make sure that we serve all of the county residents with our best intentions put forth, and not just for a political gain. I want us all to be sincere about that. Thank you, Madam Chair. Thank you, Dr. Khan.
Councilman Tracus?
Dr. Khan, I'd just like to have one follow-up question in connection with what Councilman Fitch asked you. You said if this mandate doesn't work, all options are on the table. Did I recall that correctly?
Yes, sir.
Does that include, sir, in your mind, a vaccine mandate?
I don't foresee that happening, sir.
So I can rule that out from all the options, right? That's not an option.
Yes, I'm reasonably certain you can rule that out.
So myself and everybody in this room can rest assured that at no time will you ever recommend to the county executive or anyone else that the public health department issue a vaccine mandate.
Yes.
Thank you.
All right. Any further questions? Councilman Harder.
Yeah, thank you, Madam Chair. Dr. Khan, in your health mandate, you said that everyone needs to wear a mask whether they're vaccinated or not. Is that true?
Yes, sir.
So does that
indoor
mean,
settings?
okay, in indoor settings. Does that mean the vaccine is not working?
No, sir. That has nothing to do with it. The vaccine is safe and effective against the coronavirus and all its variants. It is simply a case of a very high level of community transmission resulting in infections, even amongst vaccinated individuals. And because 55% of St. Louis County is still not vaccinated, there's a huge body of unvaccinated people who could suffer serious consequences, including death as a result.
Do you ever run into people that do not know that or do not know that they should be vaccinated or could be vaccinated in this area? Does everybody know that that's an option?
What is an option, sir? Getting vaccinated?
Getting vaccinated.
Yes, sir. We get queries every single day from people all over the county.
So with advertisement, with availability, you're giving away free shots. It's available to everybody, correct?
Yes, sir. There's more than enough vaccine and more than enough venues at which to obtain it in the county.
So we probably have more vaccine than people getting vaccines, correct?
Horrifyingly, yes.
Okay. So by making this a mandate for people that have the vaccine that you've had a hard time trying to convince, now you're telling them they have to wear a mask, which is what they were trying to avoid. Doesn't that shoot your effort of trying to get vaccines for everybody counterproductive and turn people away?
No, sir. The fact is that the stage of the pandemic that we're in right now, with the Delta variant being more aggressive and easily transmitted between people, masks plus vaccinations are the only tool we have going forward.
Okay. And based on your data collection with all the hospitals, the ICUs in St. Louis, who is occupying those? Are there people from St. Louis or people from out state?
I don't have that information, sir.
Does anyone collect that information?
The St. Louis Pandemic Task Force does. And I can tell you that while St. Louis area hospitals do receive transfers of patients from outlying hospitals, the vast majority of patients they have admitted on ICU beds are unvaccinated for COVID-related reasons, of course, and they are St. Louis area residents.
Initially, you said we needed to wash our hands and to stay 6 feet away. Does that rule still apply?
I hope so. I hope people practice those things diligently, sir. However, washing hands is a good practice anyway. As far as social distancing is concerned, the 6 feet or 3 feet or 2 feet, we've deliberately decided not to be prescriptive about that to avoid placing a burden on occupancies for restaurants and businesses.
Okay. So So if somebody just practices social distancing, that's not going to work with this Delta variant?
No, sir.
It's that powerful.
Yes, sir.
Okay, thank you, Madam Chair.
Thank you. Any further discussion? Dr. Khan, let me ask you a couple of questions because I'm very curious about the hospitalizations and I'm disappointed that you don't have that information, but I know that it was widely talked about on the media that the Springfield area, what is the hot spot here, they ran out of space and they were sending all of their patients to the St. Louis area, which means that would up our hospitalizations, but they're not necessarily the people who are in St. Louis County or city. Is that correct?
Madam, as I've stated, only a tiny fraction of the patients occupying ICU beds or beds in St. Louis area hospitals are from outlying areas. That is a usual practice that happens every day, not just for COVID, but other
But
things as well.
it has been exacerbated by the COVID or the Delta variant or whatever we're calling it these days. But it has been exacerbated by that. Would you say that?
No doubt, ma'am, because the hospitals in the Springfield area were completely overrun by the extent of the problem.
Correct. And so therefore they are shipping them to other hospitals, ours included.
Yes, ma'am.
All right. And so I want to know, because I know that earlier on this council had asked you for a plan for your outreach and how you were doing that. And I'm not sure if you sent a plan to us or not. I did not receive that, but we needed a plan for you outreach. Councilwoman Webb and I had asked for that several weeks ago about how we could get in touch with our communities with whatever is going on with the new variant. What do we need to do? And we did not receive that. Do you have a plan for your outreach?
Ma'am, that plan was submitted to you back in March. I would be more than happy to send it to you again. We have, of course, modified it and made accommodations as we've progressed, but that plan was submitted per your original request.
Okay, I don't remember receiving it, and I can check that. I could be wrong. I will admit that. Let me ask you one other question. We have a concern right now for our children going back to schools, and it's been reported that, without this mask mandate, that, these children are vulnerable. What is keeping a parent from requiring that their child wear a mask now?
Ma'am, the Centers for Disease Control and Prevention came out with a recommendation this afternoon that strongly advises mask wearing for in-person school beginning in the fall.
So,
and that is?
Again, but no, I need my question is right now, what we're doing now, if I have children of school age, and I want my children to wear a mask, what is preventing me from doing that right now?
School is not in session.
I think we're threading a needle here, Dr. Khan, and I think you know exactly what I'm asking. So let's not be coy.
No, ma'am, I'm not being coy. I'm telling you the truth.
If school were in session now,
right,
what would prevent me from requiring that my child? I don't care if the rest of the children don't do that, but what would prevent me from having my child to wear a mask to school every day?
I would hope nothing would prevent you from ensuring they wear a mask.
So then when we say that our children are at risk, if the parents are requiring and want their children to wear a mask, there's nothing in this legislation or this order that is going to prevent that or even encourage that, because it is up to the child and the school district. Is that correct?
That is correct, ma'am. We work with school districts across the region and advise them on safe in-person learning practices so that they can return to full function in fall. And one of the things we're asking them to do is ensure that their staff and their students are wearing masks, even if they're vaccinated.
Okay. The last thing I want to say, and this probably is going to Councilwoman Webb's statement, that we started out with no vaccine, of course. You asked us to stay home. You asked us to put on masks. You asked us to stay 6 feet apart. Then those were relaxed. We have done everything that you have asked us to do, and we have played by the rules. We have followed your orders, and yet we are still in a predicament. So something is not working, and I'm curious. Come on, guys. So I want to know, because again, the slippery slope is what we're starting here, it looks like to me. So I want to know what did we not do correctly?
We didn't talk to the virus about how it should behave, ma'am.
Okay. All right. I don't like to use this thing, but I will. Thank you, Dr. Khan. Let's see if there are any other questions, any other follow-up questions from any other council members. Thank you very much. Ladies and gentlemen, we don't want to have anyone removed from the audience. This is a public building, and we want you to be free to engage in what we're doing, but we will not tolerate disrespectful behavior. We will not. So we're moving on to
Item number 2.
Madam Chair.
excuse me. Yes. Okay, we're moving on. We're moving on with the agenda. So we are moving on to we're on the add-ons.
We're still on add-on.
Ladies and gentlemen, please. Okay, well, we have to have our security people to check on the outside. All right, item number 2.
Madam Chair, add-on item number 2, 3rd District.
Receive, file, and the county council be directed to prepare the appropriate legislation.
So ordered. We don't have any special committee reports this evening, so we will move on to public forum. As I mentioned earlier, we will extend this to 2 hours so that as many people as possible can say what they want to say, but we are strictly going to stay with the 3 minutes. And so watch the clock. I think we're going to have the clock up here. So with that, how many speakers do we have, Madam Clerk? Mr. Clerk?
Madam Chair, we have 54 speakers this evening.
54 speakers. So at the end of the 2 hours, we will have to stop, but we want everybody to have their opportunity to say if you possibly can. So let's try to move it quickly. If you don't have anything new to say, just say pass. We'll accept that. Okay? So with that, let's have the first person.
Our first speaker this evening, Madam Chair, is Reverend Dan Reese, followed by Ryan McGowan.
Good morning, or is it morning? What is it?
No, you're not going to this.
Yeah, I'm so confused over what I just heard. I don't even know what time of day it is. I just can't believe the stuff that I'm hearing. When I was about 14, 15 years old, my dad had a really nice Cadillac, 58 Cadillac, powder blue. He went out with some friends one time, and I had asked him, if I could use that car sometime. And he said no. So I knew he wouldn't let me. So when he was gone, I stole his keys and I took that car for a ride. Well, when he came home, the neighbor told him, "Hey, Ben, your kid took that Cadillac out." Well, he wasn't very happy about that, and he made an adjustment in my something over that issue. And that's kind of what we've got going on here. We've lost any chain of command. We have lost the accountability factor here. And because someone thought they weren't going to get approved for what they wanted to do, they just went ahead and did it. The heck with it. I'll suffer, I'll fight the consequences later, and I'll spend taxpayers' money. Just like I spent tens of thousands of dollars to get the right person who had won the election in the spot that she was supposed to be in. Our tax dollars pay for Dr. Khan. And I respect him. He believes that. I really sincerely believe he believes that. But people believe a lot of things that are stupid and wrong. And this is America. You're free to believe whatever you want. But we've lost sight of the fact that people shed blood. Their lives, their children, their mothers, their daughters, for us to have the freedom from tyranny. Tyranny is when one man says, "I will decide for you
with no checks, no balances. It got so bad that the governor of this state passed a law because of our executive. And then our executive said, oh, well, that doesn't apply to me. That doesn't apply to me. I'll get the counselor that I appoint to go around the law and write up something that's absolutely nonsense, that's unenforceable. As stupid as walking into Denny's, putting a mask on, and going carefully over to the table, and once you get at the table, you get the mask off because that's COVID-free. Can't happen there. How asinine have we become? We have lost sight of what is going on. We've killed millions of babies and nobody cares. Nobody cares. We have a law in this country, a foundation that says it would be better that one guilty man go free than one innocent man serve 1 minute in jail unjustly. This is unjust.
Madam Chair,
Thank
that's
you.
Let me end with this statement.
Thank you.
Tyranny,
Thank you.
tyranny
Thank you.
like hell is not easily conquered, but
Reverend
conquer it
Reese.
we will.
Thank you.
Our next speaker, Madam Chair, is Ryan McGowan, followed by Darius Jashani.
Thanks, partner. Mr. Page, I think you'd agree, and I think you've actually said it in the past, that most of these policies are in place to protect specifically vulnerable populations. Would you nod if you still agree with that? No? Okay. So I'm just, it said in a recent mandate that masks would not be required. Let me actually read directly from a previous. Face coverings are not required to be worn by, lists a number of things, but persons with health conditions that prohibit wearing a face covering. Nothing in this order shall require the use of a face covering by any person for whom doing so would be contrary to their health or safety because of a medical condition. I would like to point out that the World Health Organization posted in 2019 that there were 461,000 deaths from asthma globally. I have asthma. This is my albuterol inhaler. 5 of the 6 people in my immediate family have things that restrict their breathing. When you go and buy a pack of cigarettes at the store, it says on there that if you smoke, you are likely to sustain damage to your lungs. I'm wondering why businesses who are posting signs that require masks are not also posting that if you wear a mask while you have asthma, that it can do damage to your body, upper respiratory infections, complications that can lead to death. I know HIPAA allows business owners limited access to employee information regarding their healthcare, but it prevents them from any access to my background, my health issues. Would the continued mask discrimination by businesses be considered an illegal form of discrimination if I have a health exemption? I have more questions than answers because there's been nothing clear, and I know you two gentlemen spoke up about it earlier, but if the laws are not clear, how can you expect people to follow them? How can you expect people to go about asking them? I mean, the forum here is public, yes, for 2 hours, but until there is something clear, we're going to be left with more questions than answers. So I would hope that, especially someone who is a doctor, could maybe help the other doctor who's never practiced medicine figure it out. I mean, it seems odd that someone would ask me to wear a mask because they're so concerned, but they're not concerned enough to ask me if I do have a pre-existing condition, which is something that liberals have been fighting for, equal access regardless of pre-existing conditions, for north of 20 years. Okay, so if you're going to be a Democrat, you got to figure out what the liberals want. They've been fighting for this for a long time, pre-existing conditions. I just think a little bit more clarity would go a long way. Thank you.
Thank you.
Our next speaker is Darius Jashani, followed by April Linenbauer.
Hi, my name's Darius, and I'm not sure about the rest of the people here. I did get the vaccine, but it's not up to me or up to them if like what to do with my health. It really isn't. I mean, he was talking about how the health department comes down, there's an increase in stuff and has a health mandate. We don't see the 4th of July saying, the CDC recommends 2 beers per person. If, when you're drinking, you don't see the rise in DUIs, the health department come out and say you're only limited to 2 beers. And then you've lost all trust with people. I mean, you started out saying 2 weeks to bend the curve, and we're all like, all right, it's just 2 weeks, we're good. And then it was a month, and then it was 2 months, and then it was wearing a mask forever. And then you said, get the vaccine, you don't have to wear the mask. I did that, and I got no problem doing that. Other people might have religious reasons or medical reasons for whatever reason, but I did what you told me to. Why would I trust you? Why would I trust you to stop it here? Why would I trust? You know how many of my friends have gone broke, lost their life savings because you shut down their businesses? You know what I mean? I'm only 32. You know how many of my friends are facing eviction? You know how many of my friends have committed suicide because of your guys' health orders? Where does it end? I want to know where it ends. You've lost all confidence in your ability to govern. I don't trust you to stop at the mask. I really don't. It's not I get Dr. Hahn believes what he believes, but his job isn't also to think of suicide and jobs and people's rent and how people pay their bills and put food on the table and their mental health. Where does it end? I really want to know. It's not if you want to get a vaccine, that's your choice. I got no problem with it. But also it should be your choice if you want to wear a mask. I know people that haven't got the vaccine that are wearing their masks because they didn't get the vaccine and they're doing what you guys are asking them to. So to say that nobody's doing it is a lie. There's people that are following the rules. If you can't enforce everyone to do it. And by the way, how are you going to enforce the mask mandate? You said you would go in contempt of court and stuff. I got a speeding ticket in March of 2020 and have yet to get a court date. It's a year probation for driving, a year of driving probation, where if I get another ticket, I could lose my license. It's been over a year. You guys can't enforce the speeding laws right now. How are you going to enforce a mask mandate? You guys have lost all confidence in the people to govern. That's the issue here. We don't trust you anymore.
Our next speaker is April Linenbauer, followed by Renee Artman.
Good evening. Dr. Page, I'm glad you could join us tonight. My name is April Linenbauer, and I live in zip code 63043. When I first decided to speak tonight, I was going to talk about reasons why I shouldn't be forced to wear a mask, but then I realized it's much bigger than masks. It has nothing to do with masks. It has to do with the overreach of Sam Page. Dr. Page got together to scheme with the mayor of St. Louis to further their agendas, once again, bystepping their governing bodies. It's not only illegal, it's unethical, and it needs to be squashed today. This council can no longer let Sam Page steamroll his own agenda over them with no consequences. I applaud Tim Fitch for going to the news conference yesterday to let the general public know what was going on and answering questions. It amazes me that the media and the general public are not informed. I trust most of you on the council will make the right decision for St. Louis County, and thank you for all that you do. I won't take up a lot of your time tonight. I do want to make a couple of comments about Dr. Khan. I think if we are going to look at any of these things, I want numbers. I want to know how many people are from St. Louis County. I want to know how many people are in each ICU. I want to know. I spoke to somebody today who works at a hospital in North County who told me they have 4 people in CCU. One is a drug overdose, and I asked about the percentage on the COVID floor. They have no COVID floor. So, I don't know. This North County, that's where they keep saying all these big numbers are, and she says they're not, and she works in that hospital. So she said, there's COVID patients there, but it's not huge like they're leading us to believe. Anyway, have a good night. Thank you.
Our next speaker is Renee Artman, followed by Marla Fastenau.
Madam Chairman, Mr. County Exec, members of the committee, thank you for allowing us to speak tonight. Dr. Page, you're a doctor. You hired Dr. Khan? I don't know. People are confused. We can't wear a mask. We can wear a mask. You get on an airplane, they pack us in there like cattle, and then when they open the doors, they say, no, on the way out, we're going to social distance. What, I've been flying on a plane for 2.5 hours, got to know the people next to me real good, and now we're going to social distance? Makes no sense. Dr. Page, when you were elected to county exec that night, I was here. You gave the county hope. We were hopeful that we were in a mess with Mr. Stanger. This county is desperately seeking leadership. I give you an F. We have people here tonight, out in the hall, that have taken time from their busy lives, no matter how limited you try to make them. But we have a public forum. We want to be able to converse with you. I've asked you this before. We want to have a conversation to go back and forth. Not every committee meeting, maybe once every 2 months. We don't get it. We need leadership. Chairman Days has given more leadership in the short time that she has since you've been county exec. I was so hopeful when they elected you. You are a disappointment to me. And what I'm afraid of is I do not understand why you had to go to the city and make your announcement on this order. I don't understand it. And what I am fearful of, this is a prelude to you shutting us down again and closing the schools. And I'm telling you what, you think this is bad, you've seen nothing yet, sir.
Okay, that's going to be hard to follow.
Our next speaker is Marla Fastenau.
Just 1 second. Sorry. Just 1 second. Yes.
Our next speaker is Marla Fastenau, followed by Matt Debler.
Okay, sorry. Okay, I'm not here today to talk to you about whether I support or don't support the St. Louis County mask mandate. I am here to talk to you about our legislative body, the county council, and your ability to hear from your constituents, listen to the scientific evidence, if we're ever shown that, and evaluate the data, and then be allowed to make a decision on behalf of the citizens that each of you represent. The county executive, in conjunction with the city mayor, bypassed the voices of St. Louis County, of the county council and the people they represent. Sorry, I got off there. This was not a legal action. According to HB 271, they are required by state law to provide evidence to the council and have the council weigh in. Ideally, one would think a civil discussion might even happen between mature adults that have been voted to represent close to 1 million people. However, the county executive has proven time and time again that he is lacking the credibility to be mature and reasonable in these most difficult times. The county executive ignored the law and the people of St. Louis, and this needs to be rectified immediately. And by immediately, I mean later tonight. I believe our council is made up of rational, thoughtful officials. They have proven themselves in the past to not just vote down party lines, and I find that refreshing, and I applaud them for that. This is about checks and balances and following the law. So I'm asking you to repeal the mask mandate that was imposed illegally in St. Louis County. If this is revisited through the proper legal channel, then there will be a time and a place to discuss masks. And if at that time our county council votes to impose a St. Louis County mask mandate, then at least it has been done legally. The vast majority of St. Louisans are law-abiding citizens and will abide by a legal mandate, even if they personally may not agree with it. We just expect our elected officials to follow the law before imposing mandates. Thank you.
Our next speaker is Matt Debler, followed by Hans Fieri.
There's an old proverb which says, when the only tool you have is a hammer, every problem looks like a nail. For the past year, our county executive has chosen to unilaterally wield the hammer of restrictions and mandates and lockdowns. And at every opportunity, he has chosen to bypass citizen input, citizen debate, and even this very council. Now he has once again resorted to the only tool by which he knows how to lead. It's time to end this abuse. It's time to once again trust the residents of this county to make reasonable and informed decisions for themselves and for those that depend on them. It's time to allow the full democratic process to play out and how we as a community continue to weather this challenge. It's time to end rule by mandate. Thank you.
Next speaker is Hans Fieri, followed by Rusty Shackelford.
Hi, my name is Hans Feeney. I'm a resident of Baldwin, a pastor in Crestwood. I'm not here speaking on behalf of my congregation, but I did have some thoughts to share that come out of my vocation as a pastor. In a lot of ways, I think pastors, this has been really clear this last year, are in fairly similar situations to those providing medical guidance throughout this whole pandemic, which is that we have advice to give, but we don't have any real means of making people follow it. It's very easy for people to quit my congregation if they don't like what they're hearing from me. I can't call the police to make them come back. So it's obviously these mandates are incredibly difficult to enforce. A lot of people have obviously spoken about the process here. My concern, one of the things that has become very clear to me in talking with a good number of people about this throughout the last year who are on every part of the spectrum, from all the way from COVID is fake to it's the end of civilization. I'm vaccinated. I certainly encourage people to be vaccinated. But one of the things that has become abundantly clear to me in this is that there's basically two groups of folks among the unvaccinated. There are those who will never, under any circumstances, ever get vaccinated. And then there are those who are on the fence about it, those who need to be convinced. And a lot of the discussion and dialogue about this, I think, has been quite harmful in that it's spoken down to those people. It's refused to let them have a voice. It has condescended to them, and there have been many people treating them as though the reintroduction of mask mandates is more about singling people out and scapegoating people rather than bringing about higher rates of vaccination. So my great concern with reintroducing a mask mandate is all of the people that are in the sitting on the fence about getting vaccinated category are going to have all of their suspicions confirmed by telling them that once again they have to do this, that COVID's never going to go away, that this is just simply a power struggle. And I want those people to be vaccinated. I'm firmly convinced that that's the best way out of the pandemic. And I think that mandating this again is the worst possible way to achieve that end. It's only going to take those people and shift them into the never get vaccinated category. I don't want to see that happen. I'm confident that all of you want the same thing and that we want to have a healthy country and world again. And I think that despite the best intentions of the people that support this, I firmly do not believe that this will yield what it is that you want to see yielded. I think that the best thing to do is to leave this up to people themselves, to give them the space they need to make this decision in the proper time with proper respect. Thank you.
Thank you.
Our next speaker is Rusty Shackelford, followed by Craig King.
Good evening. I want to assure everyone in St. Louis County from the very beginning that we will have absolutely no tolerance for pay-to-play politics. No tolerance. We strive to set a new standard for ethical government, and we'll be open and transparent so you can hold us accountable. That was a quote from Sam Page in an article published by the St. Louis Public Radio on 4/30 of 2019. So here we are today. The county executive has not lived up to that statement. Where is the open transparency? Why does he continue to feel he has authority to call all the shots without county input? The city and the county are different governments. There are 7 council members and each represents their constituents in St. Louis County. Councilwoman Webb, you are my rep. So I'm going to speak directly to you. Why do you not have a say into the restrictions that are placed on businesses? Why do you not have a say into the restrictions that are placed on children in your district? Why do you not have a say in what restrictions and mandates are placed on your constituents? I want you to have a say. When will you have a say? The law is written for you to have a say and not be bullied by the county executive. I'm sure Councilwoman Clancy will say her usual tonight, you can't mess with the public health during a public health emergency. Well, I will say you can't use a public health emergency to be a tyrant. The government shouldn't control one's life. Our Constitution was not written this way. Our Constitution was written so that the citizens would have freedom and not be controlled by the government. The CDC has put out recommendations. Individuals need to make their own choices, not the government. God only gave us one life, so get busy living or get busy dying. Tomorrow's not guaranteed. On a different note, I'm assuming Sam Page is paying the 1% St. Louis earning tax for the time when he's doing press conferences in the city as per the city ordinance for non-residents. Thank you.
Our next speaker is Craig King, followed by Jeremy Detweiler, pardon me.
Thank you for letting me speak. I've been a resident of this county for 69 years. I've been a lawyer practicing in this county for 40 years. It's good that we get down in the weeds of detail like we are with tonight's topic. That's very appropriate. But I'm going to ask the council to click up a couple of levels to consider maybe a bigger picture. We have lived for a year and a half in chaos and systems being crazy that make no sense, and no one seems to be able to come up with a consistent reason for what is behind it all. I do not believe what I'm talking about is GOP or Democratic. It's not liberal. It's not conservative. It's much bigger and much uglier than that, much more evil than that. I believe that we are being lied to. The world is being lied to, but particularly right here in America, we're being lied to at a very, very high level. Not by you guys, You're part of this, you're part of the people being lied to, just as we are. There are big one world order type groups that have secret agencies, secret groups that want to control the world, and they've been doing that for a long time. There are videos out there of Bill Gates literally saying the words that we can reduce the world's population by several billion people through vaccines. Now that will sound absolutely crazy to someone who's never heard that. If you've not heard that, I urge you to go find it and find the people who are talking about that. It's not mainstream media. You've got to look at alternative medias that are out there that are willing to talk about these weird, strange, but possibly true things. Thank you.
Our next speaker is Jeremy Detweiler, followed by D. Broderick.
Hello, everybody. I want to thank you for giving us the opportunity to be here to speak. But I'm going to start with exactly what Craig King said. It's true. Everything he said about the worldwide depopulation of vaccinations, completely true. Look it up. So I applaud him for announcing that. What I don't want to stand up here and put anybody down or put anybody out of place, but what I would like to talk about is the small businesses that are hurting from these lockdowns and mandates. If you will, I'd like to know how in your position, how you're going to help these businesses where they're closing. They can't get employees. Because of these mandates and these lockdowns. What are you doing to assure some type of help that they can stay in business during these mandates and lockdowns? I know you're just going through the motions. I know you don't really care, but you have an agenda, and some people can respect it, but I don't, and a lot of people don't. Personally, I have friends and family members, and my girlfriend who will be speaking next, she's a small business owner, and it's watching her handle the employees that she has and trying to keep the business afloat with her partners is just, it hurts watching her go through that. And for you to sit there and feel that that's okay, that's hard. And I want to know, everybody wants to know. These fine people that all showed up, that took time out of their day to be here to support the cause of not being locked down again. We want to know what you're going to do to actually do something that's going to help rather than restrict us. So that's all I have to say.
Our next speaker is D. Broderick, followed by Alonzo Adams.
First, I want to thank everybody for being here tonight. It means the world to me as somebody who really, I live off of energy of people's happiness. And I'm not going to lie, the last year and a half has been awful. It's been miserable. The fear porn that has been pouring out of the media and been coming from every angle but science has been disturbing. Sitting in the back row and watching right now, one woman yells to the other, "I hope you die of it." This is the desire of what? You're dividing. Mandates are not helping anybody but point fingers at the other side. It started in the beginning with who's essential and who's not. I'm sorry, I'm essential. I'm a human. I'm angry. I'm sad for my team. I go to bed every night worried about 42 families who rely on my decisions, who rely on my partners, and what to do is right. And we have followed every rule. We have followed every mandate. We have not skipped a beat. And I can tell you, not a single soul reached out once to give us what to do. I own salons, guys. We've been squashed. We have been beaten on. We have been made out to be these evil, germ-flinging beings. Humans love getting their hair done. They love being touched, and they love talking to us. And just like the news conference the other day, where they now want to use us to vaccinate because we're at the ground level. You wanted to shut me down last year, and you did. And we did it. And then we were at 25% capacity until May. I'm sorry, but this is not right, and it has nothing to do with anybody's health, because we have seen thousands, and we have 0 cases connected to our salons. This is the United States of America. My family came here. We helped build St. Louis. My family built the Eads Bridge. I want to see growth again. I don't want to see mandates. I don't want to see shutdowns. But we are Americans, and we have fought from every single angle, whether it's an American Indian who was here or any European, anywhere from in this world, people came here as fighters, and we're going to fight this virus. Human life matters. We all matter, and the outreach is ridiculous. What's the point of having laws if nobody follows them? If I broke the law, I'd be in jail. But we have brand new laws. Dr. Page, I'm sorry, but I don't know how you live with yourself at night.
Our next speaker is Alonzo Adams, followed by Michael Kilgus.
Good evening, Madam, to everybody on the council, to all of the residents of St. Louis County. My name is Alonzo Adams. I'm a naval helicopter aviator veteran. I'm a business owner in St. Louis County. I'm a resident of St. Louis County. I'm a pastor whose church is located in St. Louis County. 30 years ago, I took an oath to protect against all enemies, foreign and domestic. I took that oath very seriously with my family, with my customers, and with my parishioners. I understand that there are people on all sides, and I'm not here to speak as a Democrat. I'm not here to speak as a Republican. I'm not even here to speak as black or white. I'm here to speak against right and wrong. All I care about is families and people who have been hurting. I've lost several family members and friends due to COVID, whether people think that it's real or not. Dr. Page, I don't think that you made the CDC. I don't think that you employ anybody there. I don't know anything about Dr. Hahn or Khan. If I pronounced or mispronounced his name, I apologize. What I do know is that whether or not there are some things that are being given to us as reality or not, I do know that there are a lot of people on the ships that I was on that have died from COVID. So even if it is a government conspiracy, it's in our government. We are dying, we are sick. So I would like something to be done about it. What I do know is that according to the stats from the CDC's website, not anything in Missouri, that there was 17,261 new cases in the last 7 days. In the Korean War, there was 36,516 deaths of Americans. In Vietnam, 58,209 deaths. In the Gulf War, 294 deaths. In the war in Afghanistan, 2,216 deaths. In the Iraq War, 4,497 deaths. There was 101,732 deaths in all of those wars combined. But as of the CDC 6 days ago, 609,012 total people in the United States who lost their life. If that's not real enough, I don't know what is. I apologize if it looks insensitive, but those numbers include several of my family members and friends. Whether anybody agrees or disagrees, it's really irrelevant to me. I'm not here to make anybody's one-liner in the Post-Dispatch or on somebody's page. It really doesn't matter. But speed limits were introduced and made enforceable in 1974 on January 2nd for 55 miles per hour. At that time, they decided that we were going to do this. We used to have a class called citizenship, and it said that your rights stopped when they impeded or impeached the rights of others.
Madam Chair.
Thank you,
that's 3
Mr.
minutes.
Adams. Thank you very much.
I'm
We have to
hoping that
stop now.
everybody else will have the idea that if your mask don't work for you, that's fine. But there are a lot of people who are dying because you choose or choose not to. And that's your choice.
Thank you.
Thank you.
Our next speaker is Michael Kilgus, followed by Janine Fabic.
I'd like to say hello. I want to tell you, I've been walking this earth for a long time. I was born in 1949. I grew up in the 50s and the 60s, and we had the greatest nation in the world. We didn't have any serious problems or anything that couldn't be taken care of because the people loved their country and they stood up for it and they did what they had to do and everything was fine. I joined the military in 1967 when I was 17 years old. I turned 18 October 25th of 67. I was in Nam January 6th. When I went over to Nam, we were heroes. We were the good guys. But something changed. There was a group of governmental people that got together and they started changing things. And they started making things that were important to them and not to the country. They started changing so many things that it made it difficult for a lot of us. But the thing is, we still had some control. All of a sudden now, we've got the government standing up and throwing laws down on us that we never would have had back then. We never would have had mandates for lockdowns or anything like that. The people would have had the right to choose if they wanted to get a shot. They would have had the right to choose if they didn't. They could live their lives the way they wanted to. But now all of a sudden this stuff is happening. And this is hurting the people of this country and destroying the small businesses and tearing our nation apart. And it's asinine. It doesn't make any sense. This is nothing like the America I grew up in. And it has to go back because this is idiotic. When I saw a movie that reminds me of what's happening right now, and if anybody wants to watch it, I suggest you do. It's called Amerigeddon. It shows what can happen in a situation like this, and it shows how bad things can get. It's time that the government of our country started standing up for the people, for our Constitution, and not every little thing that somebody else wants just so they can do this or do that. We have responsibilities as Americans to be Americans. And I didn't serve in the military to go down there and come out and go, oh, look at what I did. I did it because it was something my country needed. By me enlisting, I saved somebody's life because they didn't get drafted. And there's nothing wrong with that. But you know what? We were called crazy people. Crazy vets, baby killers. There's only 10% of us still alive because of that. Because the guys committed a lot of suicide and everything. We don't need that kind of crap here. We don't need the government telling us, oh, well, you're going to have to take this shot, or you're going to have to do that, or you're going to be in deep trouble. The government is supposed to take care of our country and not dominate the people.
Thank you.
Thank you.
Good evening.
Our next
Thank you.
speaker is Janine Fabic, followed by Elizabeth Cohen.
Thank you for giving me the opportunity to speak. I am not a big fan of vaccines. I've honestly only received the flu shot a couple of times. But when my public officials told me I could save other lives and I could resume my life without mask, I gladly went and got vaccinated. I have so many friends who are small business owners and restaurant owners that are hanging on by a thread, and seeing them be able to resume their business was welcome to all of us. Then the variant hit, which is exactly what viruses do. They mutate. We all know this. And individuals have chosen not to be vaccinated. We hear that Kansas City and Springfield are hotspots. How did the Kansas City mayor respond on Sunday? He states he will not restate a mask mandate. Why, Sam Page, have you decided to do this? You did not consult with the council. We elected this council to be our voice. If someone chooses not to be vaccinated, that is their God-given right. But why do I have to alter my life due to their inaction? It is their decision, and they need to understand the personal implications. And if an individual doesn't want to be vaccinated, they can continue to wear masks. This reeks of nothing but politics to me. Government overreach has gone way too far, and I, for one, am tired of my rights being trampled on. I strongly urge this council to take action tonight to end this mandate. Thank you.
Our next speaker is Elizabeth Cohn, followed by Ben Brown.
First, I want to start by saying I assure you that this is not entertainment for me. This is my life and my family and my children's lives as well. Yesterday, there were 137 cases of COVID-19 reported in St. Louis County, according to the county website. This number is being compared to June numbers, which on June 6th, there were only 28. This means we have almost 5 times as many cases, which sounds like a frightening statistic. However, if you compare the 137 cases from yesterday to the 1,153 cases reported on November 12th, we have 75% fewer cases right now. This problem with statistics is you can prove whatever point you want depending on how you present it. By the way, yesterday's cases are almost half of what they were just 3 days ago. But case numbers aren't the problem, are they? The biggest push has been to save lives. The daily deaths need to be considered to really know how we are faring. Did you know that the last time daily deaths were in double digits was during the last mask mandate? Right now, we have the lowest deaths per day since the pandemic began, despite our, quote, rising case numbers. We are averaging less than 1 death per day. In the 7 days before the St. Louis County issued this new order on July 26, 2 deaths were reported in the county for a rate of 0.2 deaths per 100,000 people. If the facts don't convince you that St. Louis County should not have a mask mandate, then all you have to do is follow the law. HB 271 prohibits restrictions on access to business organizations, churches, schools, and other places of public or private gatherings or assembly. Mask mandates limit the access to those entities to only masked individuals or individuals who fall under an exception to the mask requirement. According to HB 271, restrictions are not to be for a period of time longer than 30 days in 180-day period. The St. Louis County mask mandate ended May 14th, which was 75 days ago. That means we've already had 105 days of mandated masks in the last 180 days. HB 271 also states that a report shall be provided to the governing body, which is this council, containing information to support the need for such an order. Sam Page blatantly disregarded the law in attempting to enact a mask mandate on July 26th. The legislative branch of our government in Missouri voted in favor of House Bill 271, and our governor signed it into law. This is the way governing works in the United States. It is not a dictatorship, and Sam Page must follow the law like all the rest of us law-abiding citizens of St. Louis County. Put the responsibility for our health back in our hands where it belongs. As law-abiding citizens, it is your responsibility to vote no on the mask mandate for St. Louis County. Restore the liberty and constitutional rights of the people of St. Louis County. And also I wanted to say that the research I did showed that 30% of the patients were from St. Louis that were in the hospitals. So I don't unfortunately have the resource. Thank you all.
Our next speaker is Ben Brown, followed by Shannon Robinson.
Thank you. My name is Ben Brown. I'm a restaurant owner in St. Louis County, and I'm here to speak in favor of overturning the mask mandate Executive Page is attempting to implement by usurping the authority granted exclusively to this council by the county charter. I'm also speaking as someone who made many trips to the Capitol to testify at hearings in order to pass a bill clarifying that the power to enact health orders lies with you, the local legislative body, and not one individual that would rather rule over the county like some kind of monarch. There's been an ongoing debate about local control in our state, and I always remind people that it's actually the county council members that serve as the most direct representatives of the diverse communities throughout our county. One man cannot possibly hope to understand the many unforeseen consequences that invasive policies like these have across various demographics and segments of the population. He doesn't seem to understand that businesses in our community have watched in horror as customers have fled the county to the benefit of competing businesses in St. Charles and other neighboring counties. This policy is already having a similar effect on the very limited pool of employees, as St. Louis area businesses struggle to simply keep their businesses staffed enough to keep their doors open. It's also important to remember that a vote to overturn this mandate is not a statement about whether you agree or disagree with any perceived benefits of forced masking. This is about restoring confidence in our system and preserving what remains of the public's trust in our public health officials. An essential aspect of preserving public health is maintaining that trust between public health officials and the citizens they're meant to represent. When given the power to issue orders unilaterally, without oversight or input from the public, that trust begins to break down. In St. Louis County, that public trust has eroded greatly. As a result of health orders being enacted unchecked by one man through his proxies at the health department. This is important because this breakdown in trust has manifested itself as hesitancy among many to get the vaccine. The destructive effects of our county's heavy-handed approach, it's evident by simply taking a look at the official state of Missouri COVID vaccine dashboard. Among adults over 18, St. Louis County has vaccinated only 45% of the population, over 5% less than the state average as a whole. This is despite the fact that we are the only county paying 6 figures to employ a vaccine coordinator. If you believe the way out of this pandemic is vaccinating more of our population, then it is imperative that you vote to overturn this mandate immediately, before any remaining confidence in our health officials is lost, and with it, any confidence in their calls to get vaccinated. Thank you for your consideration.
Our next speaker is Shannon Robinson, followed by Joan Hoffman.
This vote today, for me, has nothing to do with masks. This vote has everything to do with politics and government overreach. I'm tired of Sam Page going around our elected officials trying to make laws he has no authority to make. There is a difference between assumed authority and legal authority. And you, council, are the only ones in the county that have the legal authority. Mr. Page, you have no authority to do what you're doing. I've spoken with many lawyers about this, and you can't do anything that is enforceable, and I think you know that. You operate as a dictator by scaring people, even though you have no authority, and this council needs to stop it. There was a business owner that spoke a minute ago that owned a salon, and she talked about how the people like to come in and they like to talk, and they need that communication, and they like to be touched. And what I want to talk about is how much children need that same thing. At one point in time, we used to put children in lifeboats, and I feel like we were throwing them overboard. Those children need to be held, and they need to be touched, and they need to not be treated like a disease that sometimes the media makes us feel that they are. They are not as resilient as our health directors want us to believe, and that is a fact. So much that our own local hospitals and the mental health floors, they are full for pediatrics. They are full at 100%, and we have to send our children hours away to get help. Our children need us to stand up for them and to protect them. Their numbers are not surging, like Dr. Page has said. The data on our own county site proves just that they are not surging. All citizens matter, not just COVID patients. Your constituents voted for you, council. We did not vote for Dr. Khan, the man who just told you to ignore state law and also happened to flip off the couple of hundred citizens that are outside as he left. Your constituents trust you. I trust you In your infinite wisdom, we ask you to fight, protect, and defend the soul of this county, the people in this county, and the rights of its citizens. Please stand up and represent us. Thank you.
Our next speaker is Joan Hoffman, followed by Dylan Vermeyer.
Thank you. I have to begin by saying, and I don't even know how to say it, I admire everyone on this council who was not consulted, because you must feel pretty angry. If I were in your shoes, I would be furious. This has been going on for too long, and it just needs to stop. Follow the law, Dr. Page. Consult with your counsel. I admire these people. They're being a lot nicer to you than I would in their position. I can say that, okay? I'm not trying to be rude. I'm just stating a fact. Now, there's something else I want to bring up. Ms. Webb, you talked about crime. I read your statement, and I applaud you for that, because my concern is that people are dying, but they're not just dying of COVID. And when I say that, I'm not throwing away the people who did die of COVID. That concerns me. The man who just spoke here, who lost so many members of his family, that just breaks my heart. And I have something to say about that too. But first, all the people who have been dying since this began of crime, how many of them, maybe their lives were on a different track before all of this began? We've got a media who most of their attention is going to go to what did Sam Page say, and now finally the council says something, but now they're like, oh boy, now they're all arguing. Let's get on track here. Follow the law, talk to your people. It's the right thing to do. And let's figure out how to save every life that we can. One more thing, regarding the man who just spoke here about losing his family members, I haven't heard anything about treatments, and I want to hear more about that. All we hear is prevention, which is great, okay, if it works, and we're not going to talk about that right now. That's not what I'm here for. But there's got to be more than masks, get vaccinated, okay? That could be great, but apparently it's not 100%. I don't know. But if it's not, what happens then? What happens to the people who still get sick? What are we going to do for them? Let's talk about that. You're a doctor, Dr. Page. Even if it's not your specialty, I'm sure you can find out. Okay, everyone's laughing, but I'm being serious. I'm very serious about this. Every life matters. If they're dying of COVID, let's help them. Sure, we are trying to prevent that, and I applaud that, but what are we going to do for the people who still get sick? Let's help them. And let's also, Dr. Page, please listen to Councilwoman Webb when she talks about crime, because I don't know enough about what she's talking about to say if I can help. And
Thank you, Ms.
I think she
Hoffman.
can be helped.
Thank you very much.
Our next speaker is Dylan Vermeyer, followed by Matthew Sheffer.
The real shortage in this country is common sense. My name is Dylan. I go to Mizzou. Thomas Jefferson said, if a law is unjust, man does not only have the right to disobey it, but he is obligated. You have to wear a mask. You have to register your guns. You have to get an electric car. No thanks. In this country, people are free to make the choices that affect their lives. Apparently, our government is more concerned with wearing a useless piece of face covering than the murder rate skyrocketing in our city. Seems that people, they really care about our public health and safety. The left tells us to trust science, but how do we really trust leftist science when men menstruate, unborn babies in the womb aren't babies or aren't humans? Gun control works. Studies show that masks really are useless and do not protect us. If you're unvaccinated, then wear a mask if you want to. If you're vaccinated, then why do you need to wear a mask if, in Dr. Khan's words, it protects us from all variants? If a virus is so dangerous, then why do we need to have government thugs coming to our door to jab us with an experimental drug? It's all about power. The government, it's not the government's job to run our lives. We make our own choices and we take our own risks. I carry a gun everywhere I go. Many people do. It's my choice. I do it to protect myself from dangerous things. Wearing a mask is the same. People want to wear a mask, they can wear a mask. The government is not there to tell us what to do. It's their job to protect our rights from itself. Do not comply. Do not do what the government tells you to do aimlessly and blind. Trump 2024.
Our next speaker is Matthew Sheffer, followed by Caleb Newth.
Hello. Mr. Page, I have no doubt that you have good intentions. You have a lot of burdens on your shoulders. You're concerned about citizens getting sick. But I think that it's a misplaced concern in the sense it's simply not your job. People have personal responsibility. I'm the pastor of Church of the Word. We sued St. Louis County last year. You were very respectful in some of your replies to us, and I appreciate that. We had a young man in our church, 22 years old. He had been visiting, who died of drug overdose. And one of the questions I wondered is if we had been meeting face to face, if we had been talking with him, would we have known that he lost his job because of the mandatory shutdown of the business? It was isolation that killed him. It's not just COVID that's been killing people. We have a concept in our country of self-government, personal responsibility. People have to take responsibility for their own health. We know that heart disease kills more people than anything else. Who do we listen to if we want to stop heart disease? Should we listen to the vegans? Should we listen to the carnivore diet people, the paleo people? Everybody has to do their own research and protect themselves and take personal responsibility for their own actions. Now, earlier on, I was asked by different people, what do you think about Romans 13 and the call to obey the civil government? Romans 13 says, let every soul be subject to the powers, plural, that be. And that goes for the civil government as well. We are a government with division of separation of powers, with multiple levels of accountability. And I would just urge you to stay in your lane. The civil government restrains evil, and we're grateful for that. But people have to make their own personal choices about their own responsibility for their own health. James Madison, our fourth president, known as the father of the Constitution, said, a duty before God is a right among men, which basically means all of us have our duty before God. There are certain things that are our duty directly to God. Our health is one of those duties. People need to be concerned about what they eat. Our family chose to load up on vitamin D and zinc and get out with plenty of fresh air, enjoy the company of people, and try to eat healthy and try to be healthy and think positive and be happy people. We got COVID, and it was a very mild illness for us. Also, a mask. I think about you being a doctor. You know the precautions that need to be taken with masks. Do these little children who go pick their nose and touch doorknobs and don't wash their hands and put their mask down and drop it on the floor, put it in their back pocket and then put it on their face? Are they using masks properly? Is this good for our children? Are we going to mandate little children to wear a mask everywhere? When the children are, I have 6 of them. They're filthy little creatures. I love them, but they're filthy when they're there, right? They don't know how to use a
Madam
mask
Chair,
properly.
that's 3 minutes.
Thank you, Reverend
All right,
Shepherd. Thank you.
God bless you.
Our next speaker is Caleb Newth, followed by Bridget Schmidt. Caleb Newth. Our next speaker is Bridget Schmidt, followed by Ann Boyle. Is Ms. Schmidt
Is Bridget here? Oh, I'm sorry.
Good evening. I wanted to let you know, I followed your rules. I wore my mask. I social distanced. And I washed my hands. Heck, I even washed my bananas and my oranges. I was overboard, okay? I still got COVID. So how did that happen? But I'm alive. I am a COVID survivor. What County Executive Dr. Page did yesterday was illegal. I hope the council recognizes this and votes accordingly. And I just wanted to say thank you, Councilman Fitch, Councilman Harder, Councilman Webb, and Madam Chair Days, and Councilman Tracus, you're in my district. I just wanted to thank you all for your great questions to Dr. Khan, and I hope you all have a great evening. Thank you.
Our next speaker is Ann Boyle, followed by Book Robinson.
Good evening. I'd first like to thank the council for the opportunity to share my perspective regarding the discussion on a mask requirement. It's tempting to expand on my experiences these last 16 months as a mom of 6, ages 20 down to 3. The physical, academic, athletic, emotional, and spiritual toll this has taken on my kids cannot be overstated. To see my stoic and tremendously gifted 17-year-old son break down in tears as he finally voiced the hopelessness he feels due to the effects of the pandemic is something I continue to worry about every day. But tonight, I'm here as a small business owner, the proud, exhausted, and worried owner of a little donut shop. It's difficult to put into words how hard this pandemic has been and continues to be. Our struggle is far from over. Staffing issues have forced us to cut our hours, even closing 1 day a week. Wages have gone up, and costs from sprinkles to milk to gloves have skyrocketed. We face supply issues every week and have been told to expect this to worsen. Through all of this, we double down and persevere, hoping we can tread water long enough to make it to better times. I'll be honest though, treading water is exhausting, and it's definitely not a moneymaker. And tonight, I view this proposal through this lens. I run through scenarios on how this plays out. Who enforces this? I have 8 employees between the ages of 15 and 18. The greatest, hardest working kids who serve customers with a smile at 7 a.m. These kids did not apply for a job that includes policing on behalf of the county government and engaging adults on a highly charged issue. Additionally, what is the price of enforcement and who pays it? Unfortunately, the answer to that question appears to me to be me. No mask, no service, my sales go down even more. The fallout to this falls on my shoulders, and it's hard to tread water with more pushing you down. The reality is, between vaccinations, natural immunity, vaccination exemptions, and COVID mask fatigue, the mask compliance we saw a year ago is unlikely to return. Respectfully, this is not a situation small business owners and our employees should be expected to address. Please do your job for us. Thank you for your service and your time tonight.
Our next speaker is Book Robinson, followed by David Saunders.
Good evening. The pastor earlier, he actually quoted one of our founding fathers. The quote actually is, "What is here a right towards men is a duty towards the Creator." The Holy Scriptures say in Romans 13:8, "Owe to no man anything except the debt of love." Holy Scripture saying in Philippians chapter 2, verse 3, do nothing out of selfish ambition or vain conceit. Rather, in humility, value others above yourselves, not looking to your own interest, but each of you to the interest of others. In your relationships with one another, have the same mindset as Christ Jesus. I've heard many people talk today about the rights that the government should not infringe upon. I'm at a loss though, because the Bible also says all things are lawful, but not all things are beneficial. I've heard no one talk about the willingness to sacrifice their own personal agenda for the sake of anyone else. I've heard no one say, even if I don't agree, if there's a chance that someone could be saved, it is worth that chance. I've heard no one say that. I've heard everyone either push their own agenda or, and almost at the same time, commit ad hominem and ad hoc attacks on other people for not believing as they believe. My only encouragement is not about whether even you, I got vaccinated, and I'll be honest, I didn't believe in it. I wore a mask and I didn't believe in it. I'll be totally honest with you. But the reason why I did it was because what I wanted was not the most important thing. The Constitution, the Declaration of Independence says that we are endowed with life, liberty, and the pursuit of happiness. If there are things like a 100-year pandemic that are robbing people of life, where they cannot pursue happiness, they cannot pursue liberty, and we place liberty above even the slight possibility that we can do the best and love one another and do something that might hurt me but help another person. That is not the United States. That is not America. That is not the scriptures. That is not the idea that we were founded upon. If indeed we claim to be a Judeo-Christian nation founded on Christian principles. It's the principle I need to be able to do whatever I want to do and nobody dare tell me. That does not sound like selflessness. That does not sound like esteeming others above myself. And that does not sound like the Holy Scriptures that I believe. Thank you.
Thank you.
Our next speaker is David Saunders, followed by Amanda Garvaglia.
I could spend the next.
And he needs to take that outside. I don't know if that's the reporter, because that's interrupting other people. Sir. Thank you. Mr. Saunders.
I could spend the next 3 minutes filling this room with my frustrations, nitpicking at the authorities and academics' assessment of all available data at present. I could fill your ears with some of my unorthodox beliefs about what health and wellness is and how it should be measured. I could philosophize as to how we determine what is real, objective, and true. I can make the case for what is moral and right. Sadly, these days, we would rather call each other racists, bigots, and extremists. An argument these days begins with, I feel like what you're saying is. To the point at hand, I am a clinician, and every day I hold the responsibility of ensuring excellent anesthesia care to patients of all ages. I graduated at the top of my classes here in St. Louis in my undergraduate and my graduate coursework. I am both educated and intelligent, but make no mistake, these are not the same thing. All the while, I have learned humility with each passing year. Whether it is one of my young sons outsmarting me in a game of chess, or my wife's good advice I stubbornly ignored, or a decision I had made in the clinical environment that had less than ideal outcomes. I have learned humility. Have you? Not one of us is here tonight to change our minds on these matters. But still we are here, and I ask myself why. At times I am mature enough to understand why I've become so upset with many of you. Whether you are seeking to dominate where I travel, with whom I share a smile with, what authorized genetic therapeutic I have injected into my arm, or in this case, what dirty fabric I cut out of old blankets to fashion a face covering out of. There is a place for anger, as I consider these widespread demands placed on citizens from coast to coast and from continent to continent. This is not that place. This is a place of respect from me to you, from you to me, from you to my family, from you to my neighbors, from all of you to all of us. As a clinician, I owe my patients excellent care. Admittedly, I only care for one patient at a time, and in the operating room. And so to you all, this must be more difficult, but I ask you to consider how to satisfy all, and if unable to satisfy the extremes on both sides, you hold most dear the principle of self-determination, for it is the basis of a free people. And do not forget it, we are a free people.
Our next speaker is Amanda Garvaglia, followed by Heather Brown.
Hi, my name is Amanda. Tonight I brought my daughter with me. I'm going to read what she wrote because she wanted to speak, but unfortunately she doesn't like crowds, so tonight she's not going to read her letter. So part of my 3 minutes is going to go to my daughter. When I'm at school, I can't breathe in my mask. By the afternoon sometimes, it's okay. By the afternoon sometimes, my headaches are so bad that my mommy has to pick me up. Then I have to go get a corona test. Then a kid passed out at church one day. I just want to stay at school and learn without a mask. Thank you. I know. Now tell me, Dr. Page, are you going to pay her tuition? It's okay. It's okay. It's okay. Yes, she does. She's not the only child you're hurting. So, Dr. Page, are you going to pay part of my tuition on the days that I have to pick my daughter up? She goes to private school. I'd like part of my money back. She's losing her education. I can give you probably 35 days that she missed that I had to pick her up because of a headache. And why is she picked up because of a headache? Because it's the #1 symptom on the symptom tree for COVID for kids. Do you know kids get headaches? They do. But yet my daughter has to go get a corona test because she got a headache. She doesn't even know what a headache really is. I asked her one day because she asked to go to the nurse. Mommy, the room was just too loud. So because her classroom was loud, they thought, you have a headache. Okay, she has a headache. Oh, corona test. And guess what? Those aren't free. Those are not free. We pay for those. We may not see it out of our pocket, but guess what? Our insurance goes up because of that. So none of this is free. And guess what? This right here is useless because of your mask mandate. Why did I get that? I got that for my father, which whom died alone because you make these mandates and I could not go in that room and be with him while he died. Why? Why? Why did my father have to die alone on May 3rd? Why? You robbed me of saying goodbye to my father. But yet, after my father died, we could all trample in that hospital just like this. What's the difference between walking in a hospital while he's dying compared to while he's dead? Tell me, what is the damn difference? Done.
Our next speaker is Heather Brown, followed by Sean Summers.
I'm standing before you today as a wife, mother, full-time professional employee, former sworn peace officer, avid researcher, constituent, fierce and loyal protector of loved ones, defender of freedom, and proud citizen of the United States of America. I'd like you each to think of the descriptors you'd use to describe yourselves while I read the following. That all persons have a natural right to life, liberty, the pursuit of happiness, and the enjoyment of the gains of their own industry. That all persons are created equal and are entitled to equal rights and opportunity under the law. That to give security to these things is the principal office of government. And that when government does not confer the security, it fails in its chief design. While you all will describe yourselves differently, one thing that unites you is that you are all public servants. Each of you swore an oath and duty to uphold the Constitution when you took office, and in doing so swore that protecting the rights of the people was your most important duty, specifically protecting the people's individual rights. Think back about when you decided to become a public servant. Was it after watching what was happening in your community and knowing that you could do better for the people? If you became a public servant for moral and just reasons, you will fulfill your most critical duty of office and vote down this mask mandate today. If you vote any other way, the people will be on notice to replace you because you have failed your principal duty of office and the people. Many of you in the audience will not be able to stand at this podium and make your voice heard today. For a year and a half, the people of St. Louis County have been treated as subjects under dictatorial rule by this man, Sam Page. Sam Page. So we, the people, present here tonight. Stand bravely with me, please. Stand bravely with me to correct this imbalanced, inverted power and let our public servants know we will not comply with unjust and illegal restrictions. Stand boldly with me now in peaceful but vocal non-compliance so our future generations don't have to correct these dismantled freedoms with violence like our founding fathers. Stand with me now with our voices in unison and put our public servants on notice that we will not now nor ever again allow our inalienable rights and constitutionally protected liberties be taken from us. We will give no more ground. We will not comply. We will not comply. We will not comply. And I yield.
Our next speaker is Sean Summers, followed by Emily Dallist.
First of all, I just want to say thank you. You guys,
We cannot hear him.
sorry, can you hear me now? There we go. I'm here to say that I'm a small business owner, just like many of these guys here. It's been tough. I'm not here to say that life. It's been real tough. I got 42 employees. We've followed every rule that has been placed in front of us, and not only us, but our clients as well. And as our clients are coming in, they're seeing this, and they're seeing this new mask mandate, and it's shutting them down. They're not happy. They're not wanting to come in. This just happened on Monday. So when I went to the gym that normally is packed every Monday, not a soul, not one soul. I went to stop at First Watch today, and I buy my team breakfast stuff in the morning. Not a soul. They were sending employees home when I got there. It's 2 days. Not to mention what else is there going to do. I just ask you today to think about this and the direction that it's really heading. So thank you.
Our next speaker is Emily Dallist, followed by Derek Greer.
Hi. I too am a small business owner in Baldwin. And I became a small business owner less than 24 months before the lockdown. I invested a lot of my capital in a business that got shut down. And I also have 42 employees that rely on me. The information given to us with your new mask mandate is putting all the responsibility on a business owner and a person. My front desk and my employees have to turn away staff and clients because clients and their parents because of 6 foot distances, of not being able to be in a room with their child while they're getting a haircut because there's not enough room. You're asking us to tell people to leave, and that is their income. That is my employees' income. That is the income of my family. That is the income of everybody that works with me. And you're asking us to be the police to tell them they can't come in if they don't want to wear a mask. You cannot put that on us. That is not our responsibility. That is your responsibility. You guys need to discuss this and go about the proper channels to be able to enforce anything like this. You're enforcing it based on not science. And I really need all of you guys to vote with all of these people here that are standing with us that this doesn't work. You cannot go above the law. You are not above the law. You will never be above the law. You want us to follow your law, but you don't even follow the law. Well done, sir. That's a disgraceful thing to do. Thank you very much.
Our next speaker is Derek Greer, followed by Ellen Pimentel.
Thank you all for the opportunity to be here tonight. I also want to thank every single person that's here in the chambers this evening that's giving up time away from their families, away from maybe their jobs this evening, and everyone that is gathered outside as well to support this council, to support you in an effort that was made this year to give you the authority and the power to override an overzealous executive that has gone beyond what his authority ought to provide him the power. Now, I'll tell you, so I'm a state representative. I represent the 100th district, which is Chesterfield, Baldwin, and Town and Country. Thank you. This last year has been very challenging, and your legislature saw that there was egregious overreach by a lot of people in a lot of places all over the country. And so your legislature went to work to try and provide local authorities the ability to have more choice, to provide the people with more of a voice, rather than one person being able to decree what would happen for an entire region. We went to work to give you the power and the authority to help provide a voice for more people. Now, there's a lot of work. There's a lot of work and a lot of energy that goes into providing that authority to you all. A law takes a lot of energy and a lot of effort to pass. As you know, Dr. Page, you've been there. It takes a lot of buy-in from a lot of people. And it takes a lot of people like this coming to the Capitol, telling their stories. We heard a lot of stories, many of them extremely heartbreaking, from people that were losing their businesses, from people that weren't able to see their parents in the hospital before they passed on. And we went to work and we heard all those stories. We got the buy-in from all those folks, and we passed a law to govern the state of Missouri, to govern the over 6 million people that live in this state, to allow you the opportunity tonight. We passed that law for you all tonight to exercise this authority to overrule an overzealous county executive who's gone too far. We don't believe that this mask mandate should be in place. We believe that the people ought to have a choice on when wearing a mask is appropriate and when not wearing a mask is appropriate. And we are asking you, I'm asking you in my capacity as a state representative, and I'm also asking you as a citizen of this region, please, please use that authority, allow the people to speak through you, and override this order. Please, thank you.
Our next speaker is Ellen Pimentel, followed by Michael Burton.
I didn't hear that.
Our next speaker is Ellen Pimentel, followed by Michael Burton.
Okay.
Hello, councilmen and councilwomen. Thank you for the opportunity to speak with you tonight. Unlike everyone else
Can you
here,
pull the mic down? Yes.
I'm not here to speak about the mask mandate. I'm here to speak about liquor stores going into North County. And I'm here specifically to look at you, Councilwoman Webb. We have enough liquor stores in North County. Please, okay? North County, especially unincorporated North County, has never been protected. North County was destroyed by the density of low-income housing. You disabled North County. You handicapped North County. You disabled unincorporated North County. Not this council, many years ago, many years ago. So what I'm asking you all to do is, can we please repair the damage that was done before your time to North County? My family, my friends' family, my parents' friends' families did not leave North County because it didn't break their heart to leave their houses that they worked so hard. $20,000, $25,000 houses they bought back in the 70s. They had to leave. And that was because low-income housing came in, and with low-income housing coming in, there's not enough jobs to help the people. Why were we not spreading the low-income housing to Kirkwood, to Creve Coeur, to Ladue, to Clayton? Why? Because people were there that had people in their pockets. That was the good old boys club. They were going to make sure the low-income housing didn't come. So not only have you handicapped and crippled all of us left in North County. I live in Spanish Lake. I moved in with my mother-in-law to take care of her because she has congestive heart failure, and I have to take care of her because of COVID. So I gave up my life in Fenton and moved to Spanish Lake. And I'm not going to move to Spanish Lake and not get involved in my community. It's a wonderful community. I love my community. I'm loving living there. But I want to say, please, you already have in North County that's this disability, handicap. Can you not make it worse by putting in a dense amount of liquor stores? We already have 14 liquor stores in Spanish Lake. We have 7.5 miles of area in Spanish Lake. So that means we have two places, two liquor business license in every square mile to buy liquor. Do we really need more? Do we really need more? Would Kirkwood accept this? Would Creve Coeur accept this? Would Ladue accept this? Why? Why not? Because they got people backing them. They would not accept these quick marts. Please do not allow Get and Go, Market and Grill, or quick marts to go in any more density in North County, especially Spanish Lake. They're targeting the unincorporated areas because no one is there to speak up for them. But I'm here tonight speaking up for them on my own if no one else is. And I'll be here every time. I'll be back.
Our next speaker is Michael Burton, followed by Adam Mull.
Hi all. Michael Burton here. I am a state representative in St. Louis County, and I want to thank everybody that is here today for making your voice heard. This space right here is sacred ground to me. This space let me have my voice, and it has led me and given me the opportunity to be a state representative in the state of Missouri. This space right here. I also want to say that Madam Chairwoman Days, the very first day I was in the chambers of the House of Representatives in Missouri, a colleague of mine brought your name up, and there's a lot of people that I work with that have a tremendous amount of respect for you, as I do, and I want to thank you for that. I am here because I am concerned for my community. People are dying, people are suffering, and we are indeed still in a pandemic, an actual pandemic. They are already transporting patients from Springfield, Missouri this month to Kansas City and to St. Louis because they have run out of room in Springfield, Missouri. What are we going to do if you run out of space in the ICUs here or have a nursing shortage here? I don't think anyone in here has a solution to that other than, well, people die. And if you're old and fat, too bad. It's not funny. I hear a lot about, I hear a lot about Dictator Page, right? I want everybody in here to know that Sam Page helped save Tower T, okay? Excuse me.
Okay. Okay. We need to hear him, sir. We need to hear him.
Am I going to get some extra time, madam?
No. Keep going.
I would imagine a lot of people in here voted for Donald Trump, from what I've heard. I just watched the testimony today of police officers that were beaten over the head with lead pipes during the insurrection on the U.S. Capitol. Many of these people support a man that tried to overturn the will of the people, that stepped in and stopped the peaceful transfer of power. That is dictatorial behavior. Sam Page is trying to save lives, and he has saved lives. And thank you, Sam Page. Seriously, thank you.
Thank you. Thank you, Representative.
$1.3 billion. $1.3 billion the governor is sitting on right now from CARES Act money that could be used to go into supporting small businesses in the state of Missouri. And that $1.3 billion is still sitting there, and the governor should move on that money. The reason I wear this...
Representative.
Her name is Ellen. I think she is the one we're talking about.
Representative, thank you very much. We are on a very short time frame. We had 3 minutes for everybody, and I have to move you forward. What? No. Thank you. Is this Mr. Mall?
One second. We need to get order.
Security, we cannot have the outburst. You will have to remove them if they continue to do that. Thank you.
Our next speaker is Adam Mall, followed by Haley Walton. Pardon me, Madam Chair.
Good evening, Honorable Council. My name is AJ Mall. I have been a resident of St. Louis County pretty much all my life. And I wanted to speak not about mass mandates, because that's not what we're here to talk about. We're here to talk about the ability for the legislative body, that's the county council, to hear from their constituents, listen to the evidence, and then decide on the matter. The county executive and the city mayor usurped the voices of council and the people they represent. That was illegal. They are required, Sam Page and Tashara are required by state law to give you guys the evidence and let you guys weigh in. They ignored the law, they ignored the people of St. Louis, they ignored me. This should be immediately rectified. The folks that think the vaccines don't work, and there's folks that think the double masking alone in your car are justified. That's not the issue. And I just found out that Bill Gates wants to kill me with the vaccine. These are fringe people. I had the vaccine. I believe in the vaccine. I got to get rid of my mask. That's not the issue tonight. The issue is that the power has been restored to the council, and you, Dr. Page, went and acted illegally. So please vote the mandate down. And then if you want to have a meeting and talk about a mandate, I'm happy to come back again. Thank you so much for your time.
Thank you.
Our next speaker is Haley Walton, followed by Chris Birnbaum.
Hello. So Friday, Mr. Page, you set the date to make mask mandates for yesterday. And so, I mean, you're telling me that the virus is so deadly, masks have to wait until Monday? I mean, seems like this is more of a power trip if you're asking me. Anyways, there's no scientific proof that masks work. And I think it's absolutely unfair that our children have to sit in a classroom for 7-hour days, 5 days a week. Not including the bus ride wearing a mask, suffocating while breathing in their own bacteria. So many staph infections because of masks, kids suffocating and dying while in gym because they can't remove their mask while they're running or whatever they're being required to do. There's a 99% survival rate for most people with COVID and even higher in children. I own a daycare and was considered essential, and I cannot stand that term. Anyone that depends on their job, whether it's a bar or restaurant like Benjamin Brown owns, or anybody in this, audience, and depends on that business to pay their bills, is considered essential in my eyes. St. Charles County had some case numbers, but far fewer hospitalizations and deaths, and as did other counties without mask mandates and with less shutdowns. I'm actually looking to move to St. Charles County because of you. And Sam Page did all of this without speaking to the county council first. He went right over y'all's heads, and I mean, are y'all gonna allow this? Anyways, I mean, why aren't you guys like forcing people to eat healthy instead of mandating muzzles and forcing vaccines, followed by a free donut if they vaccinate? Anyways, it's clearly not about the people, it's about control.
Our next speaker is Chris Birnbaum, followed by Suzanne Burley.
Good evening. I'd just like to say kudos to the woman who spoke from Spanish Lake. I'm North County too, and it is true enough. We've got a lot of great residents in North County, and we're getting the shaft on what goes in there. And we're tired of it, and Shawanda's going to take care of us, I believe. So my impressions of the knee-jerk St. Louis County revival of the mask mandate are shared by many. My impressions of the coercion tactics employed to vaccinate the county are also shared by many. Here's some questions that we're asking. If the vaccines you herald as 99% effective are so effective, then why is a mask required for the fully vaccinated? Number two, if the vaccinated are protected and the unvaccinated choose to remain so, why is that an issue? We'll take our risks. It's our choice. The vaccinated will remain safe, correct? Both camps made a thoughtful and personal choice, which poses no threat to the others. The risk that people want to assume as being unvaccinated is their own risk. Another point number three, anyone who hasn't been vaccinated by this time has made a personal choice not to do so. Your $150 incentive is quite frankly offensive. Although I don't believe it was intended to be. It is preying on low-income people, enticing them to alter their health choice based on what you perceive to be the greater good. $150 is spent in a heartbeat, and they are left with the consequences of perhaps a poor choice. Either way, their cognitive ability to decide their care shouldn't be toyed with. Lower economic status does not mean that you are impaired in making good personal health choices. So Sam Page and council members, be advised that freedom-loving St. Louisans are not unkind or selfish when they ask to be unmasked and have the freedom to choose. We care deeply about protecting the elderly and the most vulnerable. And I have every confidence that you are following some science, maybe the science which also believes that genders are fluid and men can give birth. But I believe it's truly following the money, and I want to see that end. Thank you.
Thank you.
Our next speaker is Suzanne Burley, followed by Angie Eisen.
Hi, good evening. I'd like to point out something that Con said tonight. That businesses would be policing this mandate. Just yesterday, a man with his 2 children went into a big chain grocery store. And there was an employee there that asked him to mask up. And he declined. So the employee policed this patron by grabbing the cart with his children in it. And he held the cart, she held the cart and told the man he had to mask up. Is that the kind of policing we're looking for? That's a very slippery slope. I may not be here tonight if somebody grabbed the cart with my children in it. So, my mom said just the other day, this was my original thought tonight. My mom said just the other day, just think about how much time each of those council members have had to spend away from their communities and their people by dealing with all of these things that Sam Page is trying to pull. I thought, thanks, Mom, for my topic tonight. I personally have not thought about how much time each of you have had to spend away from your communities dealing with this continued misuse of power by the county executive. Some of you have been fighting for months, right alongside us. Ms. Webb, from the very beginning, you've had to fight to be in your position. Ms. Days, Mr. Harder, you both had to fight an unlawful attempt to try and keep the chair and co-chair seats from both of you. And we've all been fighting forever to try and restore checks and balances. When does it end? Not only is Sam Page unlawfully breaking the charter with a second job, he's also taking time away from our communities by keeping each of you involved with these power grabs. Time that I'm sure each of you could spend with your communities. As for this latest wrongdoing, yet another insult to the county council and the constituents, Sam Page plotted with the mayor of St. Louis City to devise a mandate that affects almost 1 million people in the county. He completely disregarded the law and disrespected the council and constituents. The county councilor, or the county executive, has made it very clear he does not intend to work with you. Not all 7 members of the council. He's going to continue to work against you. HB 271 was signed on June 15th for this reason. It's simple. The law was not followed. I'm counting on each council member to stop allowing the county executive to send the message
That's 3 minutes,
that
Madam
your
Chair.
opinions do not matter.
Thank you, Ms.
Thank you.
Burley.
Our next speaker is Angie Isaac, followed by Michaela Lee.
Thank you all for allowing me to speak tonight. First of all, I want to start out with reminding each of you that Article 1, Section 1 of the Missouri Constitution says that the source of political power is from the people. It is not from you, Sam Page. It is not from any of you. It's from the people. And then I want to go on to say, you have been less than transparent. These are the things that the people of St. Louis County have a right to know. And you have failed to provide these answers. When is the county going to release solid data on those who have had COVID-19 and their rate of infection? We want to know how many were mildly symptomatic, moderately symptomatic, and severely ill. In addition, we want to know the rate of hospitalizations of those who previously recovered from COVID. Is there some sort of immunity? We want to know that. In addition, we want to know what the COVID-19 transmission numbers are and percentages from unmasked people. We want you to tell us the number of cases that have come from being next to an unmasked person. Okay. Available. We also want to know what test you are using to test for COVID-19. We want to know what test you are using to test for the Delta variant. And how are those tests differentiating from COVID-19 and the Delta variant? How are you determining the Delta variant? We want to know that. And lastly, I just want to say there were two gentlemen that spoke earlier. One was a pastor and he had lost several family members. I don't know if the other gentleman was a pastor, but he kind of alluded to fighting for freedom was selfish. Okay? I just want to say no one in this room is getting out of here alive. No one. We will all die. We will all die. Okay? And to sit here and think that you are capable of actually saving lives is playing God, okay? And you are not that, Mr. Page. None of you are. And the rights that we have come from our Creator. And see, I'm still allowed to say Creator. That may offend Mrs. Dunaway. It may offend Ms. Clancy, but I'm still allowed to say God and Creator because this is a free country.
Thank you, Ms. Isaac. The babies that have been ripped out of their mother's womb. Ms. Isaac, thank you very much.
Our next speaker is Michaela Lee, followed by Tom Shoup.
Madam Councilwoman, council members, Dr. Page, and friends.
Speak into the mic, please. Thank you.
I really don't have much more to say than has been said on the topic of the vaccines and the masks. I'm in agreement with almost everything I've heard here. I'm coming from a different angle tonight, an angle that's not considered popular anymore, but I believe is the reason that this country, that this world is in the condition that it is. Dr. Page, I would like for you to know that God loves you. Now I know that some eyes are rolling in here, and I don't know whether you have a belief in God or even acknowledge his existence, but that doesn't change the fact that he loves you. And I want to say that regardless of whether you acknowledge him or not, he is going to hold you responsible because, Dr. Page, you see, God loves people, and he's going to be watching your motives and your actions. And if they are wrong in the eyes of God, you will reap what you sow. And honestly, Dr. Page, I would really like to see you not reap bad. Because I love God, I care about you. But what's been going on is wrong. Children are sobbing and crying and begging to have their masks off, not to mention adults. But the children, why? Why would you hurt the children like this if you have a heart? You see, I will remind you one more time, God cares about people, Dr. Page, including you, and that's why he wants you to do the right thing. So I genuinely hope that you will not let these words about God's love for you fall to the ground. Because even if you don't believe in them, I could say I don't believe in mangoes, but it doesn't change the fact that mangoes exist. And your unbelief, if you have an unbelief in God, doesn't change his existence. And he is higher than you. He is higher than the president. He is the ultimate authority, and he is a just God and will deal with wrongdoing.
Madam Chair, that's 3
Thank you, Ms. Reed.
Our next speaker is Tom Shoup, followed by Brianna Kortner.
1 second before you start, Mr. Shoup, and I will let everybody know that we have till 9:15, and that's our cutoff time, okay? Thank you very much, and you can proceed.
There was once a time that many of us worried that the government would take over the healthcare system. It seems our fears were completely in the opposite. The healthcare system's taken over the government, usurped your authority, and usurped our rights. Now, occasionally on Google, the truth comes across. The New York Times reports the amount of deaths in St. Louis County from COVID to date is 2,293. In St. Charles County, 601. Now, mind you, there are 2.5 times as many people in St. Louis County as there are in St. Charles County. But that's 3.8 times more deaths in St. Louis County than St. Charles County. And we've had the mask mandates, and they haven't. Now, masks don't seem to work in that occasion, but masks do seem to sell fear. They sell fear. Now, fear is dangerous for many reasons. One of the reasons why fear is dangerous, listen, COVID deaths in hospitals. The first biggest contributor to COVID death is obesity. The second biggest contributor to COVID death in the hospital is not diabetes, is not high blood pressure, it's not asthma, it's not pneumonia, it's not cancer, it's not heart disease, it's fear and anxiety disorders. Now I can send each of you the link that tells you what the CDC says about fear and anxiety disorders that these masks help sell. Now, fear also is dangerous because it causes schools to close. And these schools close, and when they close, the children's hospitals fill up. They fill up with children who are depressed and isolated and sad and suicidal. And the children have the least amount of fear with the COVID. Listen, the masks sell fear, and they help to scapegoat the unvaccinated. They help to control the unvaccinated to get vaccinated. And this vaccine has killed more people than all other vaccines combined for the last 30 years. I'd be happy to send you the information from the study from Steve, forgot his name, but anyhow, trial site news article, and it has not been debunked. Now, instead of selling fear with the mask, what you need to do is promote hope. There is hope. There's hope with vitamin D. Most of the people who are hospitalized are insufficient with vitamin D or deficient with vitamin D. Yeah, you need to get your task force on selling vitamin D and not the vaccines. You also need to meet with your task force to promote the early treatment protocols that the CDC ignores. The early treatment protocols that use ivermectin. These frontline doctors have their early treatment protocols. They have their proof. They have their evidence. The CDC ignores them. You need to bring the evidence in front of your task force and ask them to review it together. Ask them to review the Dark Horse podcast together. And if they ignore you and will not do it together, then you know that they are compromised. There's no money in it. You need to sell hope. There is hope with ivermectin and the early treatment protocols. It will save lives. Thank you.
Our next speaker is Brianna Kortner, followed by Terry Pellich.
Say the name again, please.
Brianna Kortner, followed by Terry Pellich. We'll move on to Terry Pellich, followed by Becky King-Niehoff. Oh, sorry, excuse me.
Thank you for letting me speak. I know a lot of people have spoken about the children, but we here can defend our liberty. We can say, no, we're not wearing a mask when we go into a store. This is a gross breach of our civil liberties, but our children cannot stand up for themselves. My son was in summer school this summer at a private high school, which shall remain nameless. And one of his classmates, they give them masks to wear, okay? One of his classmates' mask was falling below his nose, and the teacher singled him out in front of the class and yelled at him, not my son, his classmate, and said, if your mask falls below your nose again, I am going to lower your grade an entire increment. This is not fair to our children. They are afraid to stand up to their teachers and the administrators, and they are suffering. They are depressed. They are sad. They do not have interpersonal communication skills. All of you who have masks on, we have no idea what you're feeling right now because we can't see your faces. Thank you, Mr. Trakas and Mrs. Days. Thank you guys for not wearing masks so you can show us your emotion and you can give us feedback. We are humans. We need intrapersonal communication, and no one needs that more than our children.
Terry, this is our last speaker? I'm sorry, one second, please.
Good evening, everybody. I'm
Okay.
Terry.
This will be our last speaker.
Our final speaker this evening, Madam Chair, is Terry Pellich.
Terry Pellich. I just want to say we all have obstacles. We've all had illnesses. I'm a baby of the 50s and 60s, so I've seen a lot of things. A lot of things that I've seen are when HIV and AIDS came, and you had to do certain things, and then it became a law that if you didn't reveal what you had, you could be criminally charged. That is a law. That is a federal law, if I recall. This mandate is merely a choice for all of us. If you want to wear it, you can. If you don't want to, fine. Okay? I also, when you go to the doctor's office and he tells you got to take a medicine, which is what happened to me, I'm going to be upfront. I didn't want to take it because of the side effects. He said, get out of my office. There's other people who I can treat. So we all have a choice. We can choose to die. We can choose to live. We can wear a mask. We don't wear a mask. But we shouldn't be at each other. We should be helping each other get through this. If somebody doesn't wear a mask and their next don't have a mask, and this happened to me the other day in a doctor's office, could you please keep your distance? You can be nice and polite about it. We don't have to be at our throats. This is the USA. We do have rights. And laws. Laws are if you run a stop sign, you get violated. This is a mandate. It's not a law. We put restrictions on ourselves, and we don't have to. I'm for the mask. I will wear the mask. As soon as I'm done here, I need to leave because I'm afraid of what I'm going to get from here.
Madam Chair.
I may be dead. Thank you.
Thank you. We're done. Thank you very much. We do appreciate the eagerness that you've come this afternoon or this evening. We thank you for your words, and we will be moving on. I want to check with the council to see if you want a 5-minute break before, or would you like to continue on? You're going to continue on. All right. We'll move, going back to Councilman Fitch.
Thank you, Madam Chair. And thank you for all your comments this evening. We really appreciate it. Madam Chair, in accordance with the authority provided in the revised statutes of Missouri, known as House Bill 271, Chapter 67, Section 265, that states, and I quote, "The governing bodies of the political subdivisions issuing orders under this section shall at all times have the authority to terminate an order issued or extended under this section upon a simple majority vote of the body. I thereby move to terminate the St. Louis County Department of Public Health 2019 novel coronavirus COVID-19 face covering order issued by Dr. Faisal Khan on July 26, 2021.
Is there a second?
Second, Harder.
Discussion.
Madam Chair.
Let's start with Councilwoman Dunaway. We haven't heard from you this evening.
Thank you so much. I would actually like to start by taking a moment to express my gratitude to all of you. You have taken so much time out of your evenings for well over a year with passionate commitment to show us how much it matters to you that 611,000 Americans are dead and that millions more have lost limbs,
Please.
and that millions more have lost limbs, livelihoods, and loved ones to a disease that grows more menacing as it feeds itself and makes itself stronger on the lives it devours in each community it devastates. You have shown us for many months just how much more your freedom to not wear a mask matters than the healthcare workers who have cried out to you through the news, beloved TV shows, documentaries, newspapers, and in government forums like this, begging for us to wear masks, get vaccinated, and bend the curve to help them not just survive this pandemic, but to get through each day in a hospital overwhelmed by death and disease. You keep showing up here without a mask, but chock full of conspiracy theories about false data claiming that more people are dying from the vaccine than the disease. All of this while unmasked, unvaccinated communities.
Just a second, Councilwoman Dunaway. Ladies and gentlemen, this is appropriate way we do this. This is protocol. This is how we handle our business. We listen to you. We have an opportunity to say what needs to be said on this council. So please, she is a council member. And you have had your opportunity to speak. And let me just say this. If we have to remove someone from this council, we will do so. But we have been patient. We are listening. And right now, the councilwoman is going to have her say. Thank you.
You keep showing up here without a mask, but chock full of conspiracy theories and false data claiming that more people are dying from the vaccine than the disease. All of this while unmasked, unvaccinated communities give the virus fuel and time to grow and mutate into something even more deadly. We cannot continue going about life as though nothing is happening while something terrible is happening. And like the hundreds of others we have heard from today by email, I live in a home with people who cannot get the vaccine. Two tiny humans who rarely complain about wearing a mask, because even they understand that COVID is bad and that while catching COVID might not be that terrible for them, it could cost their grandparents or the immunocompromised neighborhood babysitter down the street their lives. They do as they're asked to protect each other. Which is more than I can say. Go ahead.
Go ahead, because if we cannot have decorum, we will have to clear the chamber. So please.
So my little elementary kids can do as they're asked to protect each other, which is more than I can say for this room of people, as well as my colleagues up here who callously put their freedom ahead of my children's lives. You were all asked to get a vaccine. You were asked to wear a mask, and you didn't. And now with COVID on the rise in our community again, thanks to others like you who won't get a vaccine and won't wear a mask, the time has come and gone to ask you to do the right thing. Throughout this pandemic, I have been deeply saddened to see so many of my fellow Americans care so little for their neighbors, friends, and family, and to do so with such gusto and void of even an ounce of compassion. So again, I thank you. Thank you for making it so easy for me to vote my conscience tonight. There is absolutely nothing I enjoy about this vote tonight. I don't want to have to tell anybody what to do, but I can promise you all, that my vote tonight is a direct reflection of our community's unwillingness to just do the right thing for each other. Thank you, Madam Chair.
Thank you. Councilman Tracus, I believe I saw your hand.
Thank you, Madam Chair. I too want to thank you all for coming tonight. I know it was an imposition. I'm sure that you'd much rather be home with your families. What I'm going to say, some of you have heard before, no doubt. I've got a very dear friend, I'm sure, that's going to smile when he hears it. But I also want to thank you for honoring the charge given to you to keep the republic. Because make no mistake, what went on in this room tonight is exactly what Franklin, anyway, Benjamin Franklin intended. Okay, this is what he meant. This doesn't happen, you get walked on. Liberty doesn't come in increments, small doses, or watered down varieties. Liberty either is or it isn't. Liberty exists or it doesn't. Too many American men and women have given the last full measure of devotion for us to be cavalier with the very liberty they fought and died to provide. I will not abide any measures that seek to compromise or in any way erode our liberty and freedom. Madam Chair, my vote will be to support the rescission of this mandate.
Okay. Okay. Thank you. Thank you. Councilwoman Webb.
Thank you, Madam Chair. And first, thank you, Madam Chair. And first, I want to thank you all for being here. One of my big things is that we don't have to all agree. We all don't have the same reasons on how we're going to vote, but we have to be respectful of each other for this process to work. And for the most part, I commend everybody for working through and being patient for those 2 hours. I have to make this statement because I want everybody to be perfectly clear on why I make my decision. First off, North County has never taken their mask off. Every morning we get up, we make a conscious decision to mask up. The majority of the 1,500 calls and emails that I received from the last couple of days, they right here. No, this is just 400 of them. They came from outside of District 4. But I still read them. I still listened to you all. Of the calls that I did receive, I only received 28 from North County. I'm sorry, emails. And of those 28 emails, majority of them was against the mandate. Why? Because we've already decided that if we're not vaccinated, we will wear our mask. North County, what you know about me is that I listen to my community. There is evidence, and it has been proven time and time again. But one thing I will not do is play football with your lives. So Dr. Page and the NAACP, you don't have to orchestrate robocalls to me because my community knows how to get in contact with me. I am readily available and accessible. But just in case, because I'm not hiding, just in case you don't know, my direct number is 314-322-6634. See, I don't have time for political football because I'm talking about people's lives. And that goes beyond party lines and district lines. It's your life. Secondly, the people of North County also know that I don't play politics, especially through social media or any media. I work diligently on behalf of District 4. So I'm not making it hard for any leader in the county nor the city. What I'm doing is setting expectations on how to work with me. I am not the status quo or what there was before me. I am a different breed. I'm cut from a different cloth. So hear me clearly. So if you want to talk seriously and work on the issues that impact North County, my community, about crime, illegal dumping, the abundance of liquor stores, picking up trash, because I do trash pickups and volunteer spots all the time. Deal with the food deserts with no healthy options for North County, and talk about creating economic equity between North County and the rest of St. Louis County. My number is 314-322-6634. And I'm not saying that jokingly, everybody. I'm sincere. My life does not allow me to play and spend extra time doing things that have no impact. I'm here because I'm true about serving North County. I don't see this as party lines or district lines, as I've said before. I see this as saving lines. For anyone to believe that I'm not for keeping people safe, I'll just remind you, even though you may not agree, I have supported the vaccination incentives. As stated yesterday, I will support a mandate for mask wearing in St. Louis County government buildings. I also recommend and encourage everyone who is not vaccinated to protect yourselves. So if you want to make real change and deal with the core of the issue and not the symptom of the issues, make that mandate that before you walk in St. Louis County government buildings or anyone visiting these government buildings, you have to be vaccinated. That's where you stand. Again, I am serious about protecting lives, not being in political spotlights. What is the true solution in keeping my community safe and keep us from hanging in the balance? Is to be informed, to be educated, and to be vaccinated. Madam Chair, I will be voting to rescind this mandate.
Any further discussion? Councilwoman
Yes,
Clancy.
Madam Chair. Yes, thank you.
Councilwoman Clancy has the floor.
Thank you. It's been hard to listen to all these comments tonight. Things are pretty sad right now for a lot of reasons. I'm not going to go on about that, though. I'm going to talk about the matter at hand. And the question on the table is whether or not the council should rescind the mask mandate. It's unclear to me if the vote that we take tonight will actually have any legal standing. That's for the courts to decide. But the vote that we take tonight will speak volumes. And I do want everyone to know where I stand and why I take the position that I take. I hate that we have to consider this again. And I've heard that from some of my colleagues tonight, that here we are. The Delta variant is dangerous. It's raging across our state. It's feeding on our high levels of unvaccinated residents. And it's causing another alarming surge of cases, along with dangerous pressures to our healthcare system. So we have to step up again. I do unequivocally support the mask mandate for some of the reasons that I've heard others justify their votes tonight, because the mask mandate will save lives. That is based on science. The CDC today has talked about the importance of wearing masks. I have consulted with medical professionals, public health professionals. Honestly, those are the only folks I feel like we need to consult with. We are in the middle of a public health emergency tonight. And it is our duty as elected officials to look out for each other, to look out for our community, to use the best data and science possible to make those decisions on behalf of our community, especially during public health emergencies. Like Councilwoman Dunaway, I have young children in my home. My baby's going to be 7 weeks tomorrow, and I have an almost 5-year-old. They can't get vaccinated. At my son's school in University City, there were 2 COVID cases within the past month of children under the age of 5. I fear for my kids right now, and I fear for your kids and your grandkids. So tonight, I'll be supporting a mask mandate. I will always support public health and science, and I want my constituents and everyone in St. Louis County and our region to count on me to be able to do that. Thank you.
Thank you. Any further discussion? Councilman Fitch.
Thank you, Madam Chair. Sam Page and his supporters have done their best to make our discussion tonight about masks versus no masks. They want to divide us. Before we have that discussion, we have to settle his blatant violation of state law, the county charter, and county ordinances by issuing this so-called mask mandate yesterday, completely bypassing this council. House Bill 271, codified under Chapter 67, Section 67-265, and I'm going to give you all these numbers in case you all want to do your own research. It passed with overwhelmingly bipartisan support in the General Assembly and was signed by the governor on June 15, 2021. There was an emergency clause, which means it took effect immediately upon the governor's signature. House Bill 271 specifically stripped the ability of a county executive or public health director to issue health mandates and turned this over in these decisions to the local governing body. This means you have to look to the county charter and county ordinances for guidance on what he can and cannot do. The Charter of St. Louis County, Section 4.130 states, and I quote, "The Department of Public Health shall recommend to the governing entities from time to time such policies as will tend to preserve or promote the public health of the county. County Ordinance 602.020, paragraph 3 states, and I quote, "The Department of Public Health is authorized and empowered with approval of the County Council to make such rules and regulations consistent with the charter, laws, and ordinances as will tend to preserve or promote the public health of the county." To this date, the County Council has never been asked to approve any of the mandates issued by the Department of Public Health and announced by County Executive Page. I will note that the County Council did pass a resolution on December 1st, 2020, approving the Department of Public Health mask mandate. The next day, the County Executive told the public to ignore the Council's resolution, stating only his public health director had the right to issue public health mandates. If this Council terminates the mask mandate tonight that was issued yesterday, expects Sam Page to say we have no legal right to do it and will ignore our actions. Members of the public and media are encouraged to do their own research on the laws I've quoted. In other words, don't believe everything you hear Sam Page say. If Sam Page wants health mandates, this Council stands ready to hear his arguments and act on his requests. This is the legal and proper way to do this. Thank you, Madam Chair.
Thank you.
Madam Chair.
We have received a motion and a second. We have had discussion. I'm sorry.
Lisa had a hand.
Oh, Councilwoman Clancy, I apologize.
I just want to make clear, thank you, Madam Chair. I want to make clear, what we are voting on tonight is not whether or not the process was followed. We are voting on whether or not St. Louis County should have a mask mandate. I don't think that Councilman Fitch's comments, I don't think that they were helpful, and I think it's confusing, and I just want to make that clear to the public who's paying attention. So thank you.
Thank you so much. Thank you so much, Councilwoman Clancy. Any further discussion? We have a motion and we have a second. We are ready to vote. Roll call, please.
Councilwoman Clancy.
Can you remind me of how the question is worded so I make sure I get this vote right?
The motion was to terminate the St. Louis County Department of Public Health 2019 novel coronavirus COVID-19 face covering order issued by Dr. Faisal Khan on July 26, 2021. Did I get that correct?
Yes, ma'am.
Councilman Fitch?
Yes,
Thank
ma'am.
you.
My vote is no.
I'm sorry? We didn't hear.
We can't hear. Councilwoman Clancy, what is your vote?
My vote is nay. Did you get that?
We did.
Thank you.
Thank you.
Councilmember Fitch.
Aye.
Councilmember Days.
Aye.
Councilmember Harder.
For liberty, aye.
Councilmember Tracus. Councilmember Tracus. Councilmember Tracus.
Aye.
Councilmember Webb. Councilmember Webb.
Aye.
Councilmember Dunaway. Councilmember Dunaway.
Nay.
Okay, order.
Not acceptable.
Madam Chair, on
Yes.
the motion to terminate the St. Louis County Department of Public Health 2019 novel coronavirus COVID-19 face covering order issued by Dr. Faisal Khan on July 26, 2021, there are 5 ayes and 2 noes.
Okay. If you would be so kind, I'd like to say what the motion was. The motion carries. The motion carries. The public health orders are terminated. Moving on to the with the add-on, the next add-on.
We finished that.
Okay, I'm sorry.
Didn't we?
All right, here we go. We have finished the public comment. If anybody wants to leave at this particular point, you can. But we are now ready to hear the report of the county executive. Thank you. Let's see if they could around. If you are intending to stay, please have a seat. We will give the county executive the respect that he's due, and he will give his report. Thank you. County executive Page.
Good evening. The CDC this
Be
afternoon
respectful, please.
recommended that everyone in K through 12 schools wear a mask, regardless of vaccination status. That includes students, staff, and teachers. The CDC is also urging people in areas with high COVID-19 transmission, like here in St. Louis County, to wear a mask. These new recommendations come a day after St. Louis City and St. Louis County health departments put in place a mask mandate. The head of the CDC, in making her remarks this afternoon, encouraged leaders at every level of government to recommend vaccines and masking. The Delta variant is highly transmissible, and it's jeopardizing our progress.
1 second. 1 second. We will allow you to exit. Thank you.
Way to show your ass, people.
Really just undermines any credibility.
Not that they had much to begin with.
Granted, but at least it would have been appropriate. Anyway.
Okay.
On June 1st, the number of people in St. Louis County being diagnosed with COVID-19 per day was 40. Less than 2 months later, 228 people per day are testing positive for the virus. On June 1st, the positivity rate in St. Louis County was 2.9%. Today, it's 10.1%. These numbers are too alarming to ignore. We as healthcare professionals and elected leaders cannot idly stand by and let this variant rack up more and more victims with each passing day. I appreciate the pro-vaccine messaging that has come from members of this council. It's important to take a leadership role in this very challenging chapter of our history. While we diligently work to get vaccination rates higher, masks will allow our kids to get back into the classroom. Masks will allow our businesses to remain open. Masks will allow our economy to continue growing and keep people employed. Masks will allow us to keep doing what we're doing while even more people get vaccinated. Masks will help slow the spread of the virus while we continue to do all that we can to get more people vaccinated. Masks and vaccines working in tandem are the path to a safer St. Louis County. The virus continues to disproportionately affect African Americans. Not doing all we can to protect our residents is continued oppression of the oppressed. I can't imagine anyone on this council or in these chambers that would stand for that. Local legislators, many who hold full-time jobs outside of government, are under enormous pressure with the passage of recent state legislation on public health orders. While mask mandates are not one of those public health decisions for our legislative branch, it's the right thing to do to keep the legislative branch informed. Our health director is always available, like tonight, and members of our health department take calls frequently from members of the council. We are partners in governing, and following the guidance of public health experts is critical to a strong partnership in tamping down of misinformation. This is a difficult time in the history of our region and our country. Emotions are running high around public health protocols. We must listen respectfully to those we disagree with, and that includes other elected officials and members of our community. For those who are vaccinated, this may feel like punishment for doing the right thing. And I've heard that sentiment from some of you sitting here tonight. While the vaccine can protect against the virus or mitigate symptoms, it does not prevent everyone from becoming infected or passing COVID-19 on to others who are vulnerable. Until more people get vaccinated, we all must continue doing what we can to protect ourselves and others. As the head of the CDC said this afternoon, vaccines combined with masks is a proper prevention strategy. The new Delta variant, which has unique behaviors from other variants and is highly contagious, represents 80% of the new cases in the US. Wearing a mask is easy to do, and it will have a big impact. I wish more people were vaccinated, but that's not where we are right now. That's all I have. Thank you.
Thank you.
Madam Chair,
Councilman Fitch?
can I point out St. Louis City Alderman John Collins Muhammad actually came in, and he's sitting over here since I know you called on him earlier.
I did.
Thank you for Alderman for being here. And right next to him is Senator Bob Onder from the Missouri Senate, who played a huge role in Senate Bill 275. So thank you for being here as well.
Welcome to you both. Moving on to introduction of bills.
Bill number 203, introduced by Councilmember Days, an ordinance authorizing the county executive to accept grant funds totaling an amount of up to $9,890,775 from the United States Department of Housing and Urban Development, Office of Community Planning and Development, appropriating said grant funds for support of various Department of Human Services programs, and authorizing the Director of the Department of Human Services to execute necessary documents. Bill number 204, introduced by Councilmember Days, an ordinance appropriating and setting apart the sum of $90,000 from the unappropriated balance of the general fund for support of a new Chief of Staff position in the Department of Police. Bill number 205, introduced by Councilmember Days, an ordinance authorizing the county executive to accept a grant of up to $9,145 from Washington University, appropriating the same for support of the Department of Public Health's National Network of Sexually Transmitted Diseases Clinical Prevention Training Center project, and authorizing the Director of the Department of Public Health to execute necessary documents. Bill number 206, introduced by Councilmember Days, an ordinance authorizing the county executive to execute a contract with the City of St. Louis for the Department of Public Health to receive reimbursement in an amount not to exceed $100,000 for testing and treatment services provided to certain patients at the St. Louis County Department of Public Health, appropriating funds received pursuant to said contract, and authorizing the Director of the Department of Public Health to execute additional necessary documents. Bill number 207, introduced by Councilmember Days, an ordinance approving the fiscal year 2022 operating and capital budget of Bi-State Development Agency, DBA Metro, providing for the method of disbursement of funds received from the state of Missouri from the Prop A half-cent sales tax levied pursuant to ordinance number 24,245 for the Public Mass Transit Trust Fund for public transportation purposes from the amount received by St. Louis County from July 1, 2021 through June 30, 2022. Appropriating and providing for the method of disbursement the sum of $4,903,704 from funds received and held in reserve from the state of Missouri from the Prop A half-cent sales tax levied pursuant to ordinance number 24,245 for the Public Mass Transit Trust Fund for public transportation purposes for the FY 2021 police contract, providing for the method of disbursement of funds received by St. Louis County from the sales tax levied by ordinance number 6,792 from July 1, 2021 through June 30, 2022, net of the TIF transfers out, providing for the method of disbursement of funds in the Public Mass Transit Trust Fund received from July 1, 2021 through June 30, 2022 from the quarter-cent Prop M sales tax levied pursuant to ordinance number 17,153 and specifying certain conditions for providing such funding to Bi-State Development Agency. Madam Chair, that is all the bills.
Moving on to perfection.
Bill number 20, introduced by Councilmember Harder.
Please hold.
Bill number 20 is held.
Bill number 32, introduced by Councilmember Tracus.
Move to hold Bill number 32.
Bill number 32 is held.
Bill number 75, introduced by Councilmember Dunaway.
Please hold Bill number 75.
Bill number 75 is held.
Substitute Bill number 1 for Bill number 77, introduced by Councilmember Clancy.
Please hold substitute Bill number 1 for Bill number 77.
Substitute Bill number 1 for Bill number 77 is held.
Substitute Bill number 1 for Bill number 88, introduced by Councilmember Clancy.
Please hold.
Substitute Bill number 1 for Bill number 88 is held.
Bill number 139, introduced by Councilmember Days.
Please hold Bill number 139. Bill number 139 is held.
Bill number 156, introduced by Councilmember Clancy.
Please hold.
Bill number 156 is held.
One moment, Madam Chair. Thank you. Bill number 191, introduced by Councilmember Days.
Bill number, please hold Bill number 191. Bill number 191 is held.
Bill number 192, introduced by Councilmember Tracus.
Move to perfect Bill number 192, please.
Is there a second?
Second.
All in favor, please say aye.
Aye.
Those opposed,
Aye.
no. Motion carries. Bill number 192 is perfected.
Bill number 193, introduced by Councilmember Days.
I move to perfect Bill number 193. Is there a second?
Second.
All in favor, please say aye.
Aye.
Those opposed,
Aye.
no. Motion carries. Bill number 193 is perfected.
Bill number 194, introduced by Councilmember Days.
I move to perfect Bill number 194. Is there a second?
Second.
All in favor, please say aye.
Aye.
Those opposed, no. Motion carries. Bill number 194 is perfected.
Bill number 195, introduced by Councilmember Harder.
I move to perfect Bill number 195.
Is there a second?
Second.
All in favor, please say aye.
Aye.
Those
Aye.
opposed, no. Motion carries. Bill number 195 is perfected.
Bill number 196, introduced by Councilmembers Dunaway and Days.
I move to perfect Bill number 196.
Is there a second?
Second.
All in favor, please say aye.
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 No. Motion carries. Bill number 196 is perfected.
Bill number 197, introduced by Councilmember Dunaway.
I move to perfect Bill number 197.
Is there a second?
Second.
All in favor, please say aye.
Aye.
Those
Aye.
opposed, no. Bill number 197 is perfected.
Bill number 198, introduced by Councilmembers Fitch and Harder.
I move to perfect Bill number 198.
Is there a second?
Second.
All in favor, please say aye.
Aye.
Those opposed, no. Motion carries. Bill number 198 is perfected.
Bill number 199, introduced by Councilmember Webb.
I move to perfect Bill, I'm sorry, you said 199 or 200?
199.
I move to perfect Bill 199.
Is there a second?
Second.
All in favor, please say aye.
Aye.
Those
Aye.
opposed, no. Motion carries. Bill number 199 is perfected.
Bill number 200, introduced by Councilmember Webb.
I move to perfect Bill number 200.
Is there a second?
Second.
All in favor, please say aye.
Aye.
Those opposed, no. Motion carries. Bill number 200 is perfected.
Bill number 201, introduced by Councilmember Days.
I move to hold Bill number 201. Bill number 201 is held.
Bill number 202, introduced by Councilmember Clancy.
Please hold on the order of business. Please hold Bill number 202.
Bill number 202 is held. Moving on to final passage.
Bill number 320, introduced by Councilmember Clancy.
I move to hold Bill number 320.
Bill number 320 is held.
Bill number 14, introduced by Councilmembers Tracus, Days, Dunaway, Fitch, Walton Gray, Clancy, and Harder.
Move to hold Bill number 14, please.
Bill number 14 is held.
Substitute Bill number 1 for Bill number 76, introduced by Councilmembers Dunaway and Harder.
I move to hold substitute Bill number 1 for Bill number 76.
Substitute Bill number 1 for Bill number 76 is held.
Bill number 177, introduced by Councilmember Dunaway.
I move for final passage of Bill number 177.
Is there a second?
Second.
Roll call, please.
Councilmember Clancy.
Aye.
Councilmember Fitch.
Aye.
Councilmember Days.
Aye.
Councilmember Harder.
Aye.
Councilmember Tracus.
Aye.
Councilmember Webb.
Aye.
Councilmember Dunaway.
Aye.
Madam Chair, on Bill number 177, there are 7 ayes.
Bill number 177 is finally passed.
Bill number 178, introduced by Councilmember Days.
I move for final passage of Bill number 178. Is there a second?
Second.
Roll call, please.
Councilmember Clancy.
Aye.
Councilmember Fitch.
Aye.
Councilmember Days.
Aye.
Councilmember Harder.
Aye.
Councilmember Tracus.
Aye.
Councilmember Webb.
Aye.
Councilmember Dunaway.
Aye.
Madam Chair, on Bill number 178, there are 7 ayes.
Bill number 178 is finally passed.
Bill number 179, introduced by Councilmember Days.
I move for final passage of Bill number 179. Is there a second?
Second.
Roll call, please.
Councilmember Clancy. Councilmember Clancy.
She's on mute.
Aye.
Thank you. Councilmember Fitch.
Aye.
Councilmember Days.
Aye.
Councilmember Harder.
Aye.
Councilmember Tracus.
Aye.
Councilmember Webb.
Aye.
Councilmember Dunaway.
Aye.
Madam Chair, on Bill number 179, there are 7 ayes.
Bill number 179 is finally passed.
Bill number 180, introduced by Councilmember Days.
I move for final passage of Bill number 180. Is there a second?
Second. Second.
Roll call, please.
Councilmember Clancy.
Aye.
Councilmember Fitch.
Aye.
Councilmember Days.
Aye.
Councilmember Harder.
Aye.
Councilmember Tracus.
Aye.
Councilmember Webb.
Aye.
Councilmember Dunaway.
Aye.
Madam Chair, on Bill number 180, there are 7 ayes.
Bill number 180 is finally passed.
Bill number 181, introduced by Councilmember Days.
I move for final passage of Bill number 181. Is there a second?
Second.
Roll call, please.
Councilmember Clancy.
Aye.
Councilmember Fitch.
Aye.
Councilmember Days.
Aye.
Councilmember Harder.
Aye.
Councilmember Tracus.
Aye.
Councilmember Webb.
Aye.
Councilmember Dunaway.
Aye.
Madam Chair, on Bill number 181, there are 7 ayes.
Bill number 181 is finally passed.
Bill number 182, introduced by Councilmember Tracus.
Move for final passage of Bill number 182.
Is there a second?
Second.
Roll call, please.
Councilmember Clancy.
Aye.
Councilmember Fitch.
Aye.
Councilmember Days.
Aye.
Councilmember Harder.
Aye.
Councilmember Tracus.
Aye.
Councilmember Webb.
Aye.
Councilmember Dunaway.
Aye.
Madam Chair, on Bill number 182, there are 7 ayes.
Bill number 182 is finally passed.
Bill number 183, introduced by Councilmember Days.
I move for final passage of Bill number 183. Is there a second?
Second.
Roll call, please.
Councilmember Clancy.
Aye.
Councilmember Fitch.
Aye.
Councilmember Days.
Aye.
Councilmember Harder.
Aye.
Councilmember Tracus.
Aye.
Councilmember Webb.
Aye.
Councilmember Dunaway.
Aye.
Madam Chair, on Bill number 183, there are 7 ayes.
Bill number 183
183, yes,
is
ma'am.
finally passed. I am losing my place here on the thing. Go ahead.
Bill number 184, introduced by Councilmember Days.
1 second, please. I move for final passage of Bill number 184. Is there a second?
Second.
Second.
Roll call, please.
Councilmember Clancy.
Aye.
Councilmember Fitch.
Aye.
Councilmember Days.
Aye.
Councilmember Harder.
Aye.
Councilmember Tracus.
Aye.
Councilmember Webb.
Aye.
Councilmember Dunaway.
Aye.
Madam Chair, on Bill number 184, there are 7 ayes.
Bill number 184 is finally passed.
Bill number 185, introduced by Councilmember Days.
I move for final passage of Bill number 185. Is there a second?
Second.
Roll call, please.
Councilmember Clancy.
Aye.
Councilmember Fitch.
Aye.
Councilmember Days.
Aye.
Councilmember Harder.
Aye.
Councilmember Tracus.
Aye.
Councilmember Webb.
Aye.
Councilmember Dunaway.
Aye.
Madam Chair, on Bill number 185, there are 7 ayes.
Bill number 185 is finally passed.
Bill number 186, introduced by Councilmember Days.
I move for final passage of Bill number 186. Is there a second?
Second.
Roll call, please.
Councilmember Clancy.
Aye.
Councilmember Fitch.
Aye.
Councilmember Days.
Aye.
Councilmember Harder.
Aye.
Councilmember Tracus.
Aye.
Councilmember Webb.
Aye.
Councilmember Dunaway.
Aye.
Madam Chair, on Bill number 186, there are 7 ayes.
Bill number 186 is finally passed.
Bill number 187, introduced by Councilmember Days.
I move for final passage of Bill number 187. Is there a second?
Second.
Roll call, please.
Councilmember Clancy.
Aye.
Councilmember Fitch.
Aye.
Councilmember Days.
Aye.
Councilmember Harder.
Aye.
Councilmember Tracus.
Aye.
Councilmember Webb.
Madam Chair, I'm sorry.
Yes.
I just want clarification on this bill. I'm sorry that I didn't read faster. Is this to outsource the Humane Society neuter services?
We are contracting with the Humane Society to do those
Okay.
services.
Thank you for clarifying.
No problem.
Aye.
Councilmember Dunaway.
Aye.
Madam Chair, on Bill number 187, there are 7 ayes.
Bill number 187 is finally passed.
Bill number 188, introduced by Councilmember Days.
I move for final passage of Bill number 188. Is there a second?
Second.
Roll call, please.
Councilmember Clancy.
Aye.
Councilmember Fitch.
Aye.
Councilmember Days.
Aye.
Councilmember Harder.
Aye.
Councilmember Tracus.
Aye.
Councilmember Webb.
Aye.
Councilmember Dunaway.
Aye.
Madam Chair, on Bill number 188, there are 7 ayes.
Bill number 188 is finally passed.
Bill number 189, introduced by Councilmember Tracus.
Move for final passage of Bill number 189.
Is there a second?
Second.
Roll call, please.
Councilmember Clancy.
Aye.
Councilmember Fitch.
Aye.
Councilmember Days.
Aye.
Councilmember Harder.
Aye.
Councilmember Tracus.
Aye.
Councilmember Webb.
Aye.
Councilmember Dunaway.
Aye.
Madam Chair, on Bill number 189, there are 7 ayes.
Bill number 189 is finally passed.
Bill number 190, introduced by Councilmember Tracus.
Move for final passage of Bill number 190, please.
Is there a second?
Second.
Roll call, please.
Councilmember Clancy.
Aye.
Councilmember Fitch.
Aye.
Councilmember Days.
Aye.
Councilmember Harder.
Aye.
Councilmember Tracus.
Aye.
Councilmember Webb.
Aye.
Councilmember Dunaway.
Aye.
Madam Chair, on Bill number 190, there are 7 ayes.
Bill number 190 is finally passed. Moving on to resolutions.
We have 5 resolutions this evening, Madam Chair. Resolution number 1, introduced by Councilmember Harder.
Please read resolution number 1.
Resolution, whereas since May 4, 2021, the St. Louis County Council's Ethics Committee, the committee has held 3 meetings for the purpose of investigating potential violations of the St. Louis County Charter by County Executive Sam Page, the county executive, and whereas Section 3.010 of the St. Louis County Charter states, in relevant part, the county executive's entire time shall be devoted to the duties of the office, and whereas Section 11.070 of the Charter states, before entering upon the officer's duties, every officer shall file with the county clerk the officer's certificate of election or appointment and shall take and subscribe before and file with the county clerk an oath or affirmation that the officer possesses all the qualifications of the office to which the officer is chosen and is not subject to any of the disqualifications in this charter named, that the officer will support the Constitution of the United States and of the state of Missouri and will perform faithfully in office. And whereas Section 10.010 of the charter states, in relevant part, this charter may be repealed, revised, or amended in any one of the following ways. 2, by ordinance adopted by the council and submitted to the voters at a general or special election and approved by a majority of those voting on the proposition. And whereas the committee is considering the question of whether the county executive has violated Charter Sections 3.010 and 11.070 in regards to his outside work as a physician between the dates of April 30, 2019 and May 24, 2021. And whereas the Ethics Committee has a legitimate and authorized legislative purpose in conducting its investigation, to wit, oversight of the executive branch is an important council check on the county executive's power and a balance against his discretion in implementing and enforcing laws, such as those enumerated in the charter and ordinances of St. Louis County. And whereas the Ethics Committee further has a legitimate and authorized legislative purpose in conducting its investigation, to wit, to determine whether to recommend to the council to propose to the voters amendments to the charter regarding outside work by the county executive. And whereas it is incumbent upon this council to allow the Ethics Committee the opportunity to continue its work, and whereas in a letter communication to Councilmember Mark Harder dated May 14, 2021, the county executive stated that he occasionally engages in medical activities. See attachment 1. And whereas Mercy is the only source of records related to the county executive's work as a physician between the dates of April 28, 2019 and May 24, 2021 at any of the locations in the Mercy healthcare system, which includes Mercy Hospital St. Louis, Mercy Hospital South, Mercy Children's Hospital St. Louis, Children's Mercy Kansas City Hospital, Mercy Hospital Joplin, Mercy Hospital Lebanon, Mercy Hospital Washington, Mercy Bariatric Center South, Mercy Rehabilitation Hospital St. Louis, Mercy Rehabilitation Hospital Springfield, and any other hospital or healthcare treatment and or testing facility of any kind owned or operated by or affiliated with Mercy, Mercy Health, and or Mercy Hospitals East Communities. Mercy. And whereas Western Anesthesiology Associates, Inc., WAA, is the only source of records related to the county executive's work as a physician for any healthcare provider with, for, or through WAA between the dates of April 28, 2019 and May 24, 2021. And whereas at the meeting of the committee held on May 24, 2021, the committee voted unanimously to first solicit documentation regarding dates and times of the county executive's employment since April 28, 2019 from both Mercy and WAA, and further to recommend to the council that the council approve the issuance of subpoenas to Mercy and WAA if said entities do not respond to the informal request, pursuant to the council's power under Charter Section 2.190 and 102.130 St. Louis County Revised Ordinances. And whereas by letter communication dated May 28, 2021, directed to the President and CEO of Mercy, Councilman Mark Harder, Chair of the Ethics Committee, Councilman Harder, requested that Mercy provide records related to work performed by the county executive at Mercy between the dates of April 30, 2019 and May 24, 2021, including dates worked including dates worked, start times, and end times per shift per day, and whether or not the county executive was compensated for such work, as well as for records related to Mercy's review process for granting, admitting, or surgical privileges as they pertain to requirements that a physician has been actively practicing medicine for a certain number of hours since the last credentialing review, and further requested that Mercy provide such records by June 11, 2021. See attachment 2. And whereas by a letter communication dated May 28, 2019, directed to the president of WAA, Councilman Harder requested that WAA provide records related to any work performed by the county executive for WAA at Mercy or any other healthcare provider between the dates of April 30, 2019 and May 24, 2021, including dates worked, start times and end times per shift per day, and whether the county executive was compensated for such work, as well as records related to WAA's policy regarding whether its physicians must be actively practicing medicine for a certain number of hours per year in order to remain listed with the practice, and further requested that WAA provide such records by June 11, 2021. See attachment 2. And whereas in a communication dated June 28, 2021 to Council Chair Rita Days from Councilman Harder, add-on 4/6/29, Councilman Harder stated that as of that date, Mercy had not responded to the request for records that was dated May 28, 2021. See attachment 3. And whereas in add-on 4/6/29, Councilman Harder further stated that legal counsel for WAA responded to the request for records that was dated May 28, 2021 by stating that WAA would not provide the requested records at that time. See attachment 3. And whereas the council now finds that without compulsory process to Mercy and WAA, the committee is unable to conduct its investigation. And whereas the council is now advised of the findings and recommendation of the Ethics Committee, and hereby directs that subpoenas and orders be issued to compel Mercy to attend an Ethics Committee meeting on August 17, 2021 at 1 p.m. in the St. Louis County Council Chamber located at 41 South Central, first floor, Clayton, Missouri 63105, and to bring all requested books and papers. Said meeting to be noticed and treated as a public meeting under Chapter 610 Revised Statutes of Missouri and Chapter 114 St. Louis County Revised Ordinances. And whereas the council is now advised of the findings and recommendation of the Ethics Committee and hereby directs that subpoenas and orders be issued to compel WAA to attend an Ethics Committee meeting on August 17, 2021 at 1 p.m. in the St. Louis County Council Chamber located at 41 South Central, first floor, Clayton, Missouri 63105, and to bring all requested books and papers. Said meeting to be noticed and treated as a public meeting under Chapter 610 Revised Statutes of Missouri and Chapter 114 St. Louis County Revised Ordinances. Now, therefore, be it resolved by the County Council of St. Louis County, Missouri as follows. Section 1. The St. Louis County Council finds it as jurisdiction to conduct the investigation described herein pursuant to St. Louis County Charter Sections 1.030, 1.040, 2.180.14, 2.180.23, 2.180.26, 2.180.28, and 2.180.35, and 2.190, paren 2, and sections 102.110, 102.120, and 102.130 St. Louis County Revised Ordinances 1974 as amended. Section 2, the St. Louis County Council finds that it is unable, without compulsory process, to conduct adequately its investigation as described herein through its designated Ethics Committee. Section 3, the St. Louis County Council hereby directs the issuance of subpoenas and orders to compel Mercy to attend an Ethics Committee meeting on August 17, 2021 at 1 p.m. in the St. Louis County Council Chamber located at 41 South Central, first floor, Clayton, Missouri 63105, and to bring all requested books and papers to the meeting. Said meeting to be noticed and treated as a public meeting under Chapter 610 Revised Statutes of Missouri and Chapter 114 St. Louis County Revised Ordinances. Section 4, the St. Louis County Council hereby directs the issuance of subpoenas and orders to compel WAA to attend an Ethics Committee meeting on August 17, 2021 at 1 p.m. in the St. Louis County Council Chamber located at 41 South Central, first floor, Clayton, Missouri 63105, and to bring all requested books and papers to the meeting. Said meeting to be noticed and treated as a public meeting under Chapter 610 Revised Statutes of Missouri and Chapter 114 St. Louis County Revised Ordinances. Section 5, the chair of the council's Ethics Committee is hereby authorized to continue the meeting of the Ethics Committee as provided for in Sections 3 and 4 to a later date and time as may be necessary. Said continued meeting to be noticed and treated as a public meeting under Chapter 610 Revised Statutes of Missouri and Chapter 114 St. Louis County Revised Ordinances. Section 6, the St. Louis County Council hereby approves and directs the issuance of the subpoenas and orders attached hereto and is otherwise amended regarding the date and time as permitted in Section 5. Section 7, the St. Louis County Council hereby authorizes the county councilor to retain a process server and take all other necessary action to provide for service of the subpoena and orders approved in Section 6. Section 8, upon adoption of this resolution by the council, the administrative director is hereby directed to insert into the attached subpoenas the resolution number assigned to this resolution by her office.
Councilman Harder.
I move for adoption of resolution number 1.
Is there a second?
Second.
Roll call, please.
Discussion. Madam
Discussion, I'm
Chair.
sorry.
Thank you, Madam Chair. Appreciate it. I wish I could support this latest version of this resolution. Believe it or not, I really do. Because, as we all know all too well, county charter is executive centric. Tonight proves that. So it is imperative that the council exercise its authority whenever it is lawfully able to do so. However, this resolution does nothing to cure the lack of any legitimate legislative purpose for this investigation or the issuance of the subpoenas. At best, the latest alleged legislative purpose, and I quote, to determine whether to recommend to the council to propose to the voters amendments to the charter regarding outside work by the county executive, close quote, is in the end no less specious than the previously asserted legislative purpose. Even if this new purpose is colorable, there is nothing stopping this council from acting immediately to place the desired charter amendment on a ballot for county residents to vote on. The county executive has admitted he occasionally works as an anesthesiologist, so that is not in question. As such, this new stated legislative purpose is nothing more than pretextual, a pretext to continue an investigation leading to a decision to place a charter amendment before the voters, something, as I've said, we can do immediately. Accordingly, there is no legislative purpose sufficient to justify or authorize the issuance of these subpoenas, and, more importantly, to survive the inevitable court challenge to their issuance. When that challenge is successful, this council will have compromised its investigative authority and created liability on the part of the county. Because there continues to be no stated legitimate legislative purpose, I cannot support this resolution, Madam Chair. Thank you very much.
Thank you. Any further discussion? Roll call, please.
Councilmember Clancy.
Nay.
Councilmember Fitch.
Aye.
Councilmember Days.
Aye.
Councilmember Harder.
Aye.
Councilmember Tracus.
No.
Councilmember Webb.
Aye.
Councilmember Dunaway.
No.
Madam Chair, on resolution number 1, there are 4 ayes and 3 noes.
Thank you. Motion carries. Resolution number 1 is adopted.
Resolution number 2 this evening introduced by council members Clancy, Dunaway, and Fitch.
Councilwoman Clancy? You are on mute.
My apologies. I move to adopt resolution number 2.
Is there a second?
Second.
Roll call, please.
Councilmember Clancy.
Aye.
Councilmember Fitch.
Aye.
Councilmember Days.
Aye.
Councilmember Harder.
Aye.
Councilmember Tracus.
Aye.
Councilmember Webb.
Aye.
Councilmember Dunaway.
Aye.
Madam Chair, on resolution number 2, there are 7 ayes.
Motion carries. Resolution number 2 is adopted.
Resolution number 3 this evening introduced by council members Webb, Clancy, Dunaway, Fitch, and Days.
Councilwoman Webb.
Would you please read the resolution?
Resolution, whereas Dr. Henry Givens Jr. was born in St. Louis, Missouri in 1931, the third of 4 children of Henry Givens Sr. and Catherine Lucille Johnson Givens. And whereas Dr. Givens passed away on July 20, 2021. And whereas Dr. Henry Givens Jr. will forever be known as an innovative educator and administrator and a visionary whose legendary determination and hard work helped lead to his remarkable successes. And whereas Dr. Givens grew up in the storied Ville neighborhood, once the city of St. Louis Black Cultural Center, 10 minutes away from the small teaching college that he would go on to lead for 32 years. And whereas Dr. Givens graduated from Lincoln University in 1954, earned his master's degree at the University of Illinois, his PhD at St. Louis University, and attended Harvard for postdoctoral studies in higher education administration. And whereas Dr. Givens started his career in education as the only male teacher at the Old Douglas School in Webster Groves, the only accredited secondary school for African American students in St. Louis County until the end of segregation, where he taught 5th and 6th grade and eventually became the principal in 1967. And whereas Dr. Givens was instrumental in redesigning the Douglas School structure and curriculum, resulting in national achievement levels and being named as the first magnet school prototype in the country. And whereas Dr. Givens would leave Douglas School to become the first African American Assistant Commissioner of Missouri's Department of Education in 1973, where he orchestrated the merger of the Berkeley and Kinloch school districts with the Ferguson-Florissant School District, leading to more opportunities for children in poorer communities. And whereas Dr. Givens left the Missouri Department of Education in 1979 to take on a new challenge and opportunity by becoming the president of what was then known as Harris Stowe Teachers College, which at the time had only one building and offered one degree in elementary education. And whereas in 1987, Dr. Givens succeeded in having Harris Stowe designated as a historically black institution, making it one of 2 in the state, the other being Lincoln University, where Dr. Givens would go on to also serve as interim president that same year. And whereas Dr. Givens worked with former Missouri Congressman Lacey Clay and other local community leaders to expand the campus at Harris Stowe, and under his 32-year stewardship, Harris Stowe tripled its student population and grew from one building offering only one degree to a multi-building campus with 14 available degree programs, which led to a change in title from college to university in 2005. And whereas Dr. Givens' name became synonymous with Harris Stowe State University, and when he retired in 2011, the original building bore his name because he had changed the landscape of the school's midtown location and created a full-fledged campus. And whereas to honor Dr. Givens' deep connection to the Webster Groves School District community, the Webster Groves School District renamed the Webster Groves Elementary Computer School in 2018 to be the, quote, Dr. Henry Givens Jr. Elementary School, end quote. And whereas Dr. Givens' legacy is cemented in this region and beyond as a pioneer and advocate for higher education and for building and defending institutions where all students are given equal opportunity to receive a great education. Now, therefore, be it resolved by the County Council of St. Louis County, Missouri as follows. Section 1, County Council mourns the loss of Dr. Henry Givens Jr. and extends its deepest condolences to his family, friends, and colleagues, and all who have been touched and inspired by him. Section 2, the administrative director shall send a certified copy of this resolution to Dr. Henry Givens Jr.'s family and to Dr. Henry Givens Jr. Elementary School located in Webster Groves, Missouri.
Councilwoman Webb.
Madam Chair, Councilwoman Clancy, did you have any words that you wanted to share at this time?
Well, another great loss for our community. Dr. Givens was a well-known name and figure around Webster Groves for his contributions to education, particularly at Douglas School. This resolution is a nice way to honor him, and my sincerest condolences to his family, friends, and all of his loved ones. He certainly made a mark on our region for the better, and we appreciate that. Thank you.
Madam Chair, before I make a motion, I too want to express, I know it's been a long night and it was a long resolution, but like Councilwoman Clancy said, he was a great giant in our community. And he didn't do things for pay, but he did things out of passion and love. And you can see evidence of this. Although I never knew him personally, just about how much he devoted to Harris Stowe and how much he grew that university. That's labor of hard work and love. There is no pay that can substitute what it took for him to grow that university. And I too am a graduate of an HBCU university, and I'm grateful for my tutelage at Fisk University. And so with that, another great in our community has moved on. My condolences to his family, his friends, and all of his loved ones. But my challenge to us as leaders is that we get on with the business of the people and set ourselves aside, because we've had great examples of this who have passed on. And so we must be their legacy to move forward with it. So with that, Madam Chair, I would ask that we adopt this resolution 3.
Is there a second?
Second.
Second.
Call, please. I'm sorry, Councilman Tracus.
Thank you. Two things. First, I had the high honor and privilege of representing Harris Stowe for many years. And in that capacity, I got to know Dr. Gibbons. To say he was a great man is putting it mildly. It is a great loss. I agree with Councilwoman Clancy. But his legacy will live on for a long time in that university. And so it's bittersweet, but I'm glad we're doing this resolution. I thank Councilwoman Webb for doing it. I'd ask to be a co-sponsor.
Yes, sir.
Thank you, Madam Chair.
Councilman Tracus.
Councilwoman Webb?
Thank you, Councilman Tracus, and most definitely, we can add Councilman Tracus on.
Yes.
And if there are no other comments, I now move that we adopt Resolution 3.
Second. Oh, sorry.
Roll call, please.
Councilmember Clancy.
Aye.
Councilmember Fitch.
Aye.
Councilmember Days.
Aye.
Councilmember Harder.
Aye.
Councilmember Tracus.
Aye.
Councilmember Webb.
Aye.
Councilmember Dunaway.
Aye.
Madam Chair, on resolution number 3, there are 7 ayes.
Thank you. The motion carries. Resolution number 3 is adopted.
Resolution number 4 this evening, introduced by Councilmember Webb.
This resolution is just a redo. There was a typo in the resolution last week, so I just move that we adopt Resolution 4.
Is there a second?
Second.
Roll call, please.
Councilmember Clancy.
Aye. Aye.
Thank you. Councilmember Fitch.
Aye.
Councilmember Days.
Aye.
Councilmember Harder.
Aye.
Councilmember Tracus.
Aye.
Councilmember Webb.
Aye.
Councilmember Dunaway.
Aye.
Madam Chair, on resolution number 4, there are 7 ayes.
Motion carries. Resolution number 4 is adopted.
Thank you.
Our final resolution this evening, Madam Chair, Resolution 5, introduced by Councilmember Fitch.
Please read resolution number 5.
Yes, sir. Resolution, whereas COVID-19 is an infectious, contagious, communicable, and dangerous disease. And whereas the first confirmed case of COVID-19 in St. Louis County was reported on March 13, 2020. And whereas to date in St. Louis County, there have been 105,603 cases of COVID-19 diagnosed and 2,291 deaths. And whereas transmission of COVID-19 in St. Louis County is currently increasing, and the average number of new cases diagnosed daily in St. Louis County has risen from 40 in early June 2021 to 212 in mid-July 2021. And whereas, as of July 23, 2021, the United States Center for Disease Control and Prevention, CDC, estimates that over 96% of the COVID-19 infections in our region are the Delta variant, which may spread more easily. And whereas approximately 549,451 residents of St. Louis County have not yet been fully vaccinated against COVID-19, which includes both residents who are eligible to receive the vaccine and children under 12 years who are not yet eligible to be vaccinated. And whereas, according to the CDC, COVID-19 vaccination is an important tool to help stop the COVID-19 pandemic. And the vaccination helps protect people from getting sick or severely ill with COVID-19. It might also help protect people around them. And whereas the county executive continues to exclude the county council in these important health matters and mandates while spending significant time on this matter with elected officials outside of St. Louis County. Now, therefore, be it resolved by the County Council of St. Louis County, Missouri as follows. Section 1, County Council strongly encourages all eligible St. Louis County residents to receive the COVID-19 vaccine. Section 2, the County Council further encourages all unvaccinated residents and visitors, except those with natural immunity or with medical conditions or religion exemptions, to wear a mask while inside of public places and on public transportation in St. Louis County. Section 3, the County Council demands the County Executive and his acting Public Health Director work together with the County Council during this ongoing pandemic to address the important health needs of our community.
Councilman Fitch.
Move for the adoption of resolution number 5.
Is there a second?
Second.
Roll call, please.
Madam Chair,
Excuse me, Madam Chair.
1 second. Councilman Tracus.
I'll yield to Councilwoman Clancy.
Councilwoman Clancy.
Yeah, I want to make sure I heard something correct in this resolution. And does the resolution say that people have a natural resistance to COVID? That some people have a natural resistance to COVID?
Yes, it does say that. There are people
Is
that
that
have
scientifically accurate, Councilman?
Yeah, once you have COVID, you have had COVID, you have a natural immunity to it.
do you have some sources to share? Are there
Uh,
any citations in the resolution? I didn't hear
well,
any.
well, there's no
That's a deep
citations.
claim, and I think that
Yeah.
that's a little bit different than what I have heard.
Okay, well, there's no, all the numbers that I have in here came from the county counselor's office, and there's no history of any of these numbers. They're all from public sources.
I'm not talking about numbers. I'm talking about immunity to COVID.
Well, again, that's just what I know from my research.
Okay. I just wanted to make sure I heard that right. Thank you.
Madam Chair. Just 1 second. Councilwoman Clancy, are you done?
Yes, I said thank you. Thank you.
Okay, Councilman Tracus?
Thank you, Madam Chair. I can't support this resolution, and the reason is for the same reasons I made earlier with respect to the mask mandate. This is an encroachment on liberty. Everybody's entitled to their opinion with respect to vaccines, with masks, et cetera. So for those reasons and the reasons I stated earlier concerning the encroachment on liberties, I will not support this resolution, Madam Chair. Thank you.
Thank you. Did you have something to say, Beth?
Yes, ma'am, if I may.
Yes.
Madam Chair, I just wanted to correct something. Maybe I misunderstood, but as far as the discussion about the natural resistance, that was in Councilman Fitch's
Yeah, I did not,
request.
no, I was talking about the numbers came from the county counselor's office that are throughout this document. The natural immunity came from Councilman Harder's office and through me.
Thank you. Thank you for that point of clarification. I appreciate that.
Thank you. Any further discussion? Roll call, please.
Councilmember Clancy.
I'm going to abstain from this one. There's too many flaws, and we need to be very careful about the science. But I do want people to know on the record that I absolutely support a mask mandate. I support masking, and I support vaccines. So that's my vote tonight. Abstain. Thank you.
Councilmember Fitch.
Aye.
Councilmember Days.
Aye.
Councilmember Harder.
Aye.
Councilmember Tracus.
No.
Councilmember Webb.
Madam Chair, I
Yes.
just was looking up on the CDC website, and I just real quickly, Councilwoman Clancy put in immunity or natural immunity, and it talks about antibodies, but it's not enough time for me to dig through and give feedback. So just want
And
to
you
let
all
you know.
have to do that at,
Right.
your time.
Yes, ma'am.
Thank you.
With that note, wanting to be mindful of that, I vote aye.
All right.
Councilmember Dunaway. I'm sorry?
I said aye.
Aye.
Oh, God, it's late.
Madam
I didn't
Chair,
know.
on resolution number 5,
Five.
there are 5 ayes, 1 no, and 1 abstention.
Thank you. Resolution number 5 is adopted. The motion carries.
Yes, ma'am.
Moving on to unfinished business.
Item number 1.
Please hold on the order of business.
Madam Chair. On that topic, item number 1. So I don't know if you've seen the reports, but apparently what we're being told, and I'm going to ask for official investigation of this, Dr. Khan, as he left tonight, supposedly gave the middle finger to the crowd as he was leaving tonight. And if that's true, I think the county executive needs to have that investigated. If that's true, that's unbecoming conduct of any county employee. So we need to, I just wanted to put that on the record and ask if any of the county executive staff is still here, I don't believe so, or watching tonight, that they look into that and report back to the council on whether or not that's accurate.
So noted.
Thank you, Madam Chair.
Item number 2, 7th District.
Please hold.
Hold on the order of business. So ordered.
Item number 3.
Hold on the order of business, and that will be the order.
Item number 4.
Hold on the order of business, and that will be the order.
Item number 5, 4th District.
Madam Chair,
Councilwoman Webb.
There's been a lot of talk about all of the liquor license that's in District 4, and I'm really sincere about addressing that issue. So I have started that communication and getting information from the Department of Revenue and others to put in the ordinance, but more long-term to even look at a special use district or an overlay district. In the meantime, I have contacted this liquor license business, or I'm sorry, the business that's requiring this liquor license, and explained to them the situation with the overabundance of liquor stores and the vision to go forth. And they understand. They may not be in agreement, but they understand. Since I've had that conversation, the new liquor license will be denied.
Is there a second? There's your
Second.
motion. All in favor, please say aye.
Aye.
Those opposed, no. Motion carries. The liquor license is denied.
Item number 6, 4th District.
Madam Chair,
Councilwoman Webb.
just want to be explicit. This is also a new liquor license. I have talked to the owner of this business and explained she is definitely not in favor of my decision. But I explained and went into details with her on a one-on-one meeting. With that being done, the new liquor license will be denied.
Is there a second?
Second.
All in favor, please say aye.
Aye.
Those opposed, no. Motion carries. The liquor license is denied.
Item number 7.
Hold on the order of business, and that will be the order.
Item number 8, 7th District.
Receive, file, and the subdivision plat to be approved as requested.
Is there a second?
Second.
All in favor, please say aye.
Aye.
Those opposed, no. Motion carries. Moving on to new business.
Madam Chair, we have 2 prepared orders this evening. Order number 1 is in the matter of the Director of Revenue's request to transfer all interest in certain real estate bought by him as trustee at the collector's 2003 tax sale.
I move for adoption of order number 1.
Is there a second?
Second.
All in favor, please say aye.
Aye.
Those opposed, no. Motion carries. Order number 1 is adopted.
Prepared order number 2 is in the matter of the Director of Revenue's request to transfer all interest in certain real estate bought by him as trustee at the collector's 2003 tax sale.
I move for adoption of order number 2.
Is there a second?
Second.
All in favor, please say aye.
Aye.
Those opposed, no. Motion carries. All right, ladies and gentlemen, it has been a long night. Thank you so very much for your patience and indulgence. We thank the audience who's still here. I would like to know if there's any other further business for the good of the order. Councilman
Madam Chair.
Harder.
Yes, I would just like to thank Chairwoman
Days.
Days.
It's breaking up here. Yeah. I would like to thank Chairwoman Days for running a great meeting under very difficult circumstances and her strong personal, please clap, her strong personal will to get through this meeting. And these meetings are very difficult. And I just want to thank you for that. And on behalf of the rest of the council, but I'm sure they would like to thank you individually, but you got through it. We all got through it, and thank you very much for your
Thank
your
you, Councilman
professionalism.
Harder. Thank you. Any further discussion? Councilman Fitch.
I'd like to thank the security folks here tonight, the police and security officers here, so thank you for that. Appreciate that.
Councilwoman Webb.
Madam Chair, I have an announcement. Yes, there will be a Justice, Health, and Welfare Committee meeting this Thursday on July 29th at 4:30 concerning the municipal courts.
Thank you. Any further business to come before the body this evening? I'll take a motion to adjourn.
So moved.
So moved.
Second.
All in favor, please say aye.
Aye.
Those opposed, no. Motion carries. Meeting is adjourned. Thank you all very much.
Thank you.